not here, they missed their time.
And call the committee to order. Today, we're going to hear from our colleagues about the issues of importance to them within our committee's jurisdiction. This hearing fulfills a new requirement that was approved as part of the House Rules Package for the 116th Congress, and I think it's a good idea. The Energy and Commerce Committee is working hard to build a stronger economy, create more good-paying jobs, combat climate change, and protect consumers from skyrocketing costs that make it increasingly difficult to make ends meet. We're putting consumers first, and I'm proud that a lot of our work in this area has been done in a strong bipartisan fashion. Just yesterday, the House overwhelmingly approved a bipartisan bill that will put consumers back in control of their phones by targeting annoying and illegal robocalls. And just last week, the Energy and Commerce Committee advanced a bill that will protect patients and families from surprise medical bills. This bipartisan cooperation is nothing new. This committee has a proud tradition of working together to meet the needs of the American people. We also have a proud tradition of listening to the ideas of members not on this committee and incorporating their ideas or advancing their proposals as we work to develop the best legislation possible. So we look forward to continuing to listen to the ideas of all members, and this hearing today will help with that in the coming months. So today we're going to break up the testimony. Well, let me say, we've asked members to tell us if they're coming, and so we've created time slots essentially, and we're going to try to stick to that. But if somebody does show up who's doesn't have a time slot, we're still going to hear from them, but we're trying to do it that way. And we also broke it up by the jurisdiction of our 5 legislative subcommittees. So, and the subcommittee chair, I've asked the subcommittee chair of that particular jurisdiction to be here when we concentrate on that issue. So, for example, right now, Mr. Doyle is here. He's the chairman of the Communications and Technology Subcommittee. And so the people that we scheduled for this time spot in the next hour or so would primarily focus on that. But you don't have to. You know, you want to talk about other things, that's fine, but we tried to do it that way. So we begin with the issues within the jurisdiction of our Communications and Technology Subcommittee, followed by Consumer Protection and Commerce, then Energy, then Environment and Climate Change, and then we're going to end with our Health Subcommittee. We have about 50 members who said they're going to testify before us. I don't know if they'll all show up, but we'll see. And everybody is asked to speak for 5 minutes. So now I'll turn it over to our ranking member from Oregon. And, you know, again, he and I have been tried as much as possible to work in a bipartisan fashion, and I appreciate that, Greg.
It's mutual. Thank you, Mr. Chairman, and welcome to our members who are here today. I think this is really an important improvement in how the committee operates. We have had member days before, and they haven't been as wide-ranging as this, but I think this is a good addition. As you may recall, Mr. Chairman, we did this for the opioids legislation package we did last time, and we ended up with 60 individual pieces of legislation, all of which were bipartisan, that moved across the House floor and eventually became one bill called the Support Act, H.R. 6. But members come here to make a difference and to offer up their ideas, not just here in this committee, but also across the entire scope of the House. And for those that aren't members of the Energy and Commerce Committee, we welcome you. We look forward to your ideas and concepts. My only regret is we didn't do this in January or February, but at least we're doing it before the August break. And so I think that's important. As I say, a good addition, and we've got a lot of work to do in this committee, and we want to hear from you. So with that, Mr. Chairman, I will yield back, and we can get on about our business.
I thank our ranking member, and I should also mention that Mr. Latta from Ohio, who's the ranking member of the Communications and Technology Subcommittee, is here as well. So what's our order? All right, so just so you know, Mr. Brindisi is first. I think, Mr. Takano, they have you a little later, but since you showed up early, we're going to put you second. We're putting you second. And we're not doing this, you know, D versus R. We're just, you know, based on the list that we put together. So we'll start with the gentleman from New York. Thanks for being here.
Good morning, Chairman Pallone, Ranking Member Walden, Subcommittee Chairman Doyle, and Ranking Member Latta. Thank you for the opportunity to testify at today's Energy and Commerce Committee Member Day. I appreciate your strong leadership on several of these issues. So my largely rural district in upstate New York stretches from Lake Ontario in the north all the way down to the Pennsylvania border in the south. So when I hear cable executives talk about 5G access or 10 gigabyte connections, I'm left shaking my head. For many families in my area, basic internet access remains out of reach. Worst of all, I have heard from countless constituents who have seen their cable bills go up every month as service just gets worse and worse. I've heard stories from families who see their connections grind to a halt at home when they try to get online. And when they contact their cable company, they get no help, only excuses. As I see it, there are 3 areas where Congress can do the most good when it comes to delivering high-speed internet access to rural America. First, we need better data. Even the FCC agrees that the data they use to map homes with high-speed internet is woefully inadequate. We need better information from companies so we know exactly where federal investments are needed most. I want to thank the committee for making this issue a top priority. Second, we need to continue to expand programs which build out broadband access in rural areas. This includes maintaining the FCC Universal Service Fund programs and ensuring that each unique program receives the funding it requires. And as we continue to invest in these vital programs, we need strong oversight at the FCC to make sure internet service providers are fulfilling their obligations. And that brings me to my third point, accountability. These cable behemoths often operate as monopolies, leaving customers no choice but to overpay for subpar service. In New York, one cable company in particular failed to live up to the terms of their corporate merger agreement and had to be fined and threatened with expulsion from the state by our Public Service Commission. The first bill I introduced in Congress, the Transparency for Cable Consumers Act, would force companies like this to disclose information about their business practices to bring transparency and accountability to the market. By doing so, we can curb the worst monopoly practices and perhaps help introduce real competition into the market. I've been fortunate to work with many members of this committee, Republicans and Democrats, on these priorities this year. Expanding access to high-speed internet remains a task as large as rural electrification 100 years ago, and I look forward to continuing the work with this committee to ensure every home in rural America is connected. I want to thank you for your time, and I'm happy to answer any questions and yield back my time. Thank you.
I thank the gentleman. Now, again, I mean, nobody has to ask questions, but I think you should feel free to do so, or comments, and we would do it. Oh, there's no questions at all? Oh, we're just listening? All right, well, I didn't know that.
Mr. Chairman. Mr. Chairman,
Yes.
are we allowed to make a comment? I'm not going to ask a question.
I'm shocked that you didn't like the idea of not asking questions. But yes, feel free to make a comment.
Actually, I do like that idea.
Okay.
No, and I was just a couple comments. Anthony, there isn't anyone on this committee that doesn't agree that the mapping issue is a complete disaster and needs to be improved, though. That's something we've talked about on the committee for a long time. I just want to say with regards to getting broadband deployed into rural America, there's not a valid business case for that, so we need money to do that. And every time we talk about expanding broadband to rural America, it's like, how do we pay for it? Well, we have an opportunity to pay for it with the C-band. There's going to be an auction. That hasn't been determined how that auction's going to take place, but I think it would be almost unimaginable that we would allow a private auction and for foreign satellite companies to keep the money. I'm hopeful that's not going to happen, but we have an opportunity here on the committee to work on a C-band plan that will allow us to start deploying that mid-range band, which is important for 5G, and get a pay-for, and to get some money into the Treasury, which could help us deploy broadband in rural America. It's a way to close the digital divide, and there's money to pay for it. So I'm hoping that members on this committee and both our side and our friends on the Republican side can come together and do something legislatively to see that made a reality. Thanks, Mr. Chairman.
Look, I understand we weren't supposed to ask questions or comments, but you're here for a few hours, members of the committee. So if you want to briefly make a comment or ask a question, I'm not going to forbid it. And I'm going to be bad myself and say that I did want you to know, you may already know that we have a bill called the Lift America Act, which every member, every Democratic member, at least on the subcommittee, on the committee, has signed, which has about $40 billion for broadband in underserved areas. So we're very conscious of that. Thank you so much. I'm going to go to Mark Takano next, the chairman of the Veterans Committee.
Thank you, Chairman Pallone and Ranking Member Walden and members of the committee. I appreciate the opportunity to testify today. I want to start off with a brief quotation from a constituent. My office obtained a consumer complaint to the FTC from a constituent, and this complaint, this excerpt, clearly demonstrates what so many customers experience as online shoppers. And I quote, "When you place an order, you are automatically enrolled in a monthly membership, which incurs an automatic charge each month to your account and credit card of $40 without permission. This is not clear at all when ordering. I never agreed to it," end quote. Amazingly, the reason why my constituent and so many other online shoppers are getting swindled is really not in dispute. It's obvious. These deals rely on a murky sales tactic known as negative option billing, which reverses the structure of a typical consumer purchase. Many of us have been there. You're shopping online, you sign up for an enticing so-called risk-free trial offer only to get hammered later with hidden fees and unexpected costs. I see nodding heads from the chairman and the ranking member. Often, we could feel foolish for having fallen for something, but actually it's very deceptive marketing and specific tools of online sellers that I think are bilking consumers unfairly. Now, these transactions, these online deals have duped consumers out of more than $1 billion during the last decade. Related complaints to the Federal Trade Commission more than doubled between the years 2015 and 2017. These transactions allow a business to interpret a customer's lack of action to reject an offer as an approval to be charged for goods and services. Expensive obligations can go misunderstood or unnoticed for months while the costs pile up. Making matters worse, customers seeking to terminate their purchase or enrollment are often met with cumbersome and confusing cancellation and return policies. These outcomes, I think, we would regard as unacceptable. And that's why I encourage the committee to consider legislation I've introduced which addresses this important topic. My bill, which is titled the Unsubscribe Act, will give shoppers the protections needed in today's online marketplace and ensure negative option deals cannot be used unfairly to deceive consumers. And this bill, my bill, would achieve this in 3 ways. First, require a straightforward cancellation process. Businesses are required on my bill to provide a cancellation mechanism that mirrors the enrollment process, ensuring consumers can escape an unwanted deal as easily as they were lured into it. It's common sense. If you sign up online, you should be able to cancel online, not have to go and wait on a telephone line for 20 minutes before you talk to somebody who can say, okay, and explain to them. There should be an easy way for you to opt out again. Secondly, we need to protect consumers from getting stuck in an expensive, unwanted deal. We would require sellers to obtain additional affirmative consent to bind consumers at the end of free trial periods. This way, consumers are protected from accidentally enrolling in a pricey membership plan if they only intended on making a single purchase. Thirdly, we would ensure that consumers remain fully and fairly informed. Online shoppers are required to receive periodic notification of any and all obligations or changes to their contracts, proactively reminding buyers of recurring charges, re-enrollment details, and agreement changes that will help decrypt the complex nature of negative option agreements. Now, members of this committee, I'm sure, completely understand how critically important it is for consumers to receive protections that keep pace with today's gigantic online marketplace. In the first quarter of 2019 alone, U.S. online retailers raked in over $135 billion. And during the past decade, the proportion of online sales to our entire retail market jumped from about 4% to over 10%. At a time when more and more Americans use their phone or computer to shop, Congress must step up to ensure no consumer is left unfairly vulnerable to misleading and abusive online deals. Thank you, and I yield back my time.
Thanks so much. Mr. Doyle?
I guess it sounds like an issue for the Federal Trade Commission, probably Congresswoman Schakowsky's subcommittee.
Absolutely.
This would be more germane there. But Mark, I think it's a great piece of legislation.
Thank you.
And Mark, we've really been trying to put a lot of focus on consumerism, if you will, and Jan Schakowsky, who chairs the Consumer Protection Subcommittee, I'm sure would be very interested in this. So thanks a lot. Thanks for coming.
Mr. Chairman, could I say something as well? I appreciate it as well. I remember when we were in business, we would find these little charges on our phone bill. When we go to chase them out, there were things we'd never agreed to, and it was only $1 or $2 a month.
Yeah.
And then you fought with the phone company, and they said, oh, we're just the biller. It's a third party, you'll have to take it up with them. Things you never agreed to, and you'd be months fighting this. And I just always wondered, with bazillions of phone lines out there, how much of this was going on where people didn't know they were getting an extra $1 or $2 a month. It's a little different than your shopping deal, but it's the same thing.
Yeah, and
consumers getting ripped off.
Sometimes you have to take a couple of steps to figure out, because the description on the bill is not all that clear, and then it's not straightforward about how to find out, as you say, who do you go to?
Yeah,
Anyway.
and somebody's making, the people doing the billing are making money.
That's right.
Put it on your
There's a
bill.
little- everyone's taking a piece of it.
Everybody's getting their piece out of our hide, and so I'm interested in this as well.
Thank you. Thank you, Ranking Member. I appreciate it. Thanks.
Thank you, Mr. Takano.
Am I excused?
You're excused, yes. All right. So next we're going to go to the gentleman from Hawaii, Mr. Case. Good to see you.
Moving right across the country, Chair Pallone, Ranking Member Walden, members, thank you so much for allowing me to share my thoughts on some issues of concern to Hawaii and to our country, I believe. I'd like to focus today on what I believe are needed changes to the 1996 Communications Decency Act that are unintentionally preventing my state and its counties, as well as many others throughout our country, from enforcing our planning and zoning laws and implementing overall public policy in affordable housing, community safety, and other critical areas. The internet has brought much progress to our world, and Section 230 of the Communications Decency Act, which provides internet platforms with some broad immunity from liability for third-party content posted on their sites, has been a part of that. But today's massive internet platforms that offer services cannot be allowed to knowingly facilitate law-breaking in our states and localities by hiding behind CDA 230 immunity. Congress first saw and addressed the modern misuse of CDA 230 last year when we passed the Allow States and Victims to Fight Online Sex Trafficking Act, FOSTA, legislation, which imposed accountability for internet platforms that were profiting from human trafficking. In a parallel situation, though, this issue is also especially acute with respect to platforms that advertise and sell illegal short-term vacation rentals like Airbnb, TripAdvisor, HomeAway, VRBO, or Flipkey. In this area, the online host platforms claim that CDA 230 prohibits states and counties from prohibiting and regulating such rentals and from penalizing platforms that knowingly sell them illegally. By one account, my own state of Hawaii alone hosts now approximately 23,000 short-term vacation rental units, and that was 2017, meaning 1 out of every 24 of our housing units was a short-term rental. That was widely considered to be low then and has only grown since, driven largely by the ease of advertising and reserving these units online. The vast majority of these units are illegal, since we know that legal permitted short-term vacation rentals are in the low thousands. The negative consequences of this unregulated disruption of our housing market impact all segments of our society. First, anytime we knowingly and practice widespread lawbreaking, that has its own broader consequences. Second, these units operate as the functional equivalent of hotels and yet do not pay hotel-required taxes and fees and do not comply with labor, workplace safety, or consumer laws. Third, these units turn residential neighborhoods into the functional equivalent of hotel zones with the loss of those neighborhoods and the community sense. And fourth, and possibly most important from my perspective, they completely distort our already sky-high housing market, which in Hawaii is one of the highest in the country. But this happens in any jurisdiction where this issue is prevalent. And because these residential dwellings are effectively converted to hotel rooms, the available owner and renter markets are compressed, leading to substantially higher rents and home prices that crowd out still more local residents in what is already one of the highest rent and lowest homeownership areas of our country. There should be a way to compel short-term rental platforms to remove these illegal units from their inventory, and yet CDA 230 serves as a roadblock to that effort. In particular, the platforms have frequently asserted that CDA 230 does not allow full implementation of and enforcement of these initiatives. They have sued cities such as San Francisco, Boston, Santa Monica, New York, and Miami Beach, and possibly others, claiming that CDA 230 preempts local regulatory efforts to take down illegal listings. Although the U.S. Court of Appeals for the Ninth Circuit upheld a lower court ruling in the Santa Monica case recently that found that the short-term rental companies did not have a valid claim under 230, the assertion still chills the remedy. This pattern has repeated itself throughout our country as states and counties have continued to pursue a number of initiatives to prevent illegal rentals while attempting to withstand legal challenges from the online platforms. State of Hawaii, for example, passed legislation in 2016 which would require operators posting on rental platforms to list their legal tax identification number and platforms not to host advertising which does not contain such numbers. The city and county has followed suit in trying to regulate these illegal rentals recently. And in that new ordinance, which was just enacted about 2 weeks ago, was a prohibition on the platforms facilitating short-term rentals for units that are not properly registered, permitted, or otherwise allowed. I strongly disagree that CDA 230, either in language or intent, can be used as a legal shield against these types of common-sense regulations. And I cannot accept that in any event that federal law does not allow states and cities to adopt and implement reasonable planning and zoning laws and instead to accept the broad negative social consequences of non-enforcement of illegal rentals, especially when those platforms know full well that their business model relies largely on knowing breaches of the law by their operators and advertisers. My request to this committee is to formally examine this and other abuses of CDA 230. We can follow the FOSTA legislation which gives us a roadmap, and I hope to work closely with you on this undertaking. Thank you very much.
Thank you, and we will certainly look into it. You know, I represent the Jersey Shore, so, you know, when we talk about rentals and tourism economy. And I guess it's an opportunity for me to say right now that I know the members are here today for this members' hearing, but, you know, don't hesitate personally with me or the rest of us or with your staff to contact us as a follow-up today. It's not like, you know, you're just here and we disappear, all right? We want you to understand that.
Appreciate that very much. We'll be taking you up on that kind offer.
Right. Thanks a lot. Thanks, Ed. And next, I think, is my colleague from New Jersey. Have you recovered from prom night, or dare I ask that question? You have not? Okay. Well, if you'll proceed, I appreciate it, my friend.
Mr. Chairman Pallone and Ranking Member Walden, it's good to see you both this morning. I thank you for the opportunity to highlight the need for transparency and regulation in the badly corrupted primary and secondary live events ticket marketplace. Been in the press a lot lately. We tried 9 years ago unsuccessfully, and I think it's time again that we look here. So one of my favorite groups is Metallica, where a lot of the young people today like to go to their concerts and spend, and I think they have to give a pint of blood too in order to get in there because the tickets are so expensive. I followed this marketplace for over a decade. Wherever I May Roam is one of Metallica's songs. wherever I go across the country, Canada, I hear complaints from my constituents on their frantic Ticketmaster, frantic experience with ticket sales. And you can't believe the mail that we get on this subject. It's the furthest thing from all of our minds when we come to work in the morning, but I'm telling you fact of life here. The combined behemoth dominates a $9 billion per year industry and holds over 80% of market share. They have sway over everything, including the peanuts you buy there. The record sales, licensing, the talent management, venue ownership, ticket sales, the concessions, down to selling hot dogs and pretzels. You name it, it's there. If there ever was a monopoly, this is it. Sorry, Mr. Holden, you blew it. You know what I'm talking about. He permitted the merger of. The GAO study of the live tickets industry that Chairman Pallone and I requested notes questionable industry practices that surprise no one who has tried to buy tickets. It's important to emphasize the marketplace has been governed by zero federal regulation. Live Nation operates with impunity. Another Metallica song, nothing else matters to them but profits. It's time for Congress to turn the page, pass legislation to add regulation, impose some order, and stop bad actors who make a living by ripping off regular folks daily. The better oversight of secondary sales and accountability of concert ticket, better known as the BOSS Act, geez, I wonder why we named it that, is endorsed by all the consumer groups and attacks problems of both the primary and secondary ticket marketplace. The BOSS Act makes one easy fix, bans the last second fees, requires every seller advertising all fees up front, which none of them do. GAO estimated that primary and secondary ticketing companies charge fees averaging 27% and 31% of the ticket price. In my neighborhood of Paterson, New Jersey, that's called thievery. At the FTC's ticket forum last month, nearly every stakeholder agreed that they could accept such a law. And for fans, all-in pricing would allow for easier comparison, stopping to find the best deal. The BOSS Act lets ticket buyers know how many tickets are going on sale, how many are going to be held back, and where those tickets are coming from. It will also prevent those with connections to venues and artists from knowingly reselling tickets at a jacked-up price. For the secondary marketplace, the BOSS Act addresses speculative ticket sales and so-called white label sites that trick consumers. I first introduced the bill 12 years ago when there was a major issue with Bruce Springsteen tour, and these problems are not going away. Just last week, Billboard magazine uncovered the latest scam. Unbeknownst to fans, apparently Ticketmaster Live Nation was working with the band's management to hold back 88,000 tickets and post them directly on resale sites. That's sad, but it is true. Ticketmaster has denied past participation in such schemes, but in the case of Whiplash, Live Nation admitted to the scheme last week, and about a dozen artists between 2016 and 2017. It could still be doing the same. This is wrong. I think we need a commitment to toll the bell for an end of the unregulated ticket marketplace by passing the BOSS Act. And I'm open for any questions, and I duly appreciate your time and your efforts on all the issues that you deal with.
Well, I'm going to thank you. I know that you've been out front on this and been trying to tackle this problem, and we do consider a priority, and we'll take it up in the fall. Hopefully, you and I can talk more about it. And of course, I appreciate you reminding me about the boss and Bruce Springsteen, because I am looking forward to being back to the Jersey Shore and the Asbury Park and all the venues that he hangs out in.
Stone Pony.
Yes, Stone Pony as well. The gentleman.
Just a quick question, Mr. Pasquarello, thank you for bringing this to our attention. And on a side note, can you tell us how many Metallica song titles were in your testimony? 12. Got 11 of them. All right. Oh, you turn on your mic. We want to hear this.
They're advertising for, they're coming up to the New York City area. But that's the only reason why I did. I happen to like the group myself.
There's just, you learn a lot at Member Day, and knowing that Mr. Pasquarello is a fan of Metallica is something I learned today. So this is.
Well,
I have
thank
to
you.
look for. I have to search for my talents. I don't. I have so few. But that interesting. And I closed out my statement, Mr. Weldon, on For Whom the Bells Toll, which is one of my favorite old movies and books. They have a song, Metallica, For Whom the Bells Toll. And I hope it tolls for Ticketmaster. It was the worst thing that happened, allowing them to join. They own the market. They own 85% of the entire. I mean, we go after airlines sometimes and this and that. Monopolies have become, part of us now. That's not good. You know why? Our kids, well, my kids have grown, want to go to a concert. You need a wheelbarrow full of money. Literally. Or else they can't go. Baseball games. You're getting that. And, nobody watches over this. It's entertainment. Say, well, if you don't want to spend the money, don't go. Well, that's very true.
we promised to look into it. And although I have to say that I think I would have preferred the band that you had last night to Metallica myself, but All right, thanks a lot, Bill. We appreciate it.
My honor, thank you.
And next, we're going to go to the gentleman from Georgia, Mr. Bishop.
Thank you very much, Mr. Chairman. I'd like to thank you, Chairman Pallone and Ranking Member Walden, and the members of the House Energy and Commerce Subcommittee on Health for giving me the opportunity to testify this morning on an issue of great importance to the delivery of health care, especially in rural communities across the nation. The issue is non-emergency medical transportation, or NEMT, which currently provides Medicaid beneficiaries with rides to medical appointments every year. This benefit, which has been in place since Medicaid's inception in 1966, has come under attack recently by the Centers for Medicare and Medicaid Services, which has sought to roll it back by making it optional at the state level. Such a change would have wreaked havoc on millions of Americans' ability to get to and from their medical appointments quickly and, most importantly, safely. Individuals who bear the highest burden of chronic conditions, including cancer, HIV, substance abuse disorder, and end-stage renal disease, would not have been able to access vital medical services like chemotherapy, physical therapy, and dialysis. They also would not have been able to travel to pharmacies to obtain their prescription drugs or their medical supplies. In Georgia alone, non-emergency medical transportation provided patients transportation nearly 60,000 times last year to pharmacies to pick up prescriptions that are important for their adherence to a plan of care. Ending Medicaid coverage for non-emergency medical transportation would literally have been a matter of life and death for many of these individuals. Earlier this year, I sent a letter to Representative Rosa DeLauro, who chairs the House Appropriations Subcommittee on Labor, Health, and Human Services, Education, and Related Agencies, as well as to Ranking Member Tom Cole, opposing this change. Our letter requested legislative language in the appropriations bill blocking funding for the implementation of that rule change. It was signed by the entire Congressional Black Caucus in the House and received important bipartisan support from a number of my Republican colleagues in the House. I'd like to ask unanimous consent that that letter be included in the record with my testimony.
Without objection, so ordered.
56 non-emergency medical transportation stakeholders, including groups representing Medicaid beneficiaries with substance user disorder, behavioral disorders, and end-stage renal disease, also sent a letter opposing the rule change. I'd like to ask unanimous consent that the list of those people be included in the record also. I'm pleased to report that the language was successfully added to the FY 2020 Labor HHS Appropriations Bill in an amendment that was offered as a manager's amendment by Chairwoman DeLauro. Following its inclusion in the bill, we heard word from CMS that they won't try to promulgate the rule until after the 2020 elections. Although this is welcome news, we still have to be vigilant and ensure that this important benefit remains available to our most vulnerable citizens. Yesterday, I joined my colleagues Tony Cardenas, Tom Graves, and Buddy Carter in introducing bipartisan legislation that would codify the Title 19 of the Social Security Act, the Medicaid Transportation Benefit. The bill, H.R. 3935, would simply preserve the status quo. It would add non-emergency medical transportation services for individuals without other means of transportation to the list of mandatory benefits that every state Medicaid program is required to provide by law. According to CBO, the bill would have no cost provided that we act before CMS publishes the proposed rule. I'm hopeful that the legislation will be considered quickly by this subcommittee for inclusion in the extenders package by the end of the year. In the coming weeks, we plan on introducing legislation on the Medicare front as well. The legislation will provide coverage for non-emergency medical transportation for patients who qualify for Medicare based on that end-stage renal disease. The measure is being finalized as we speak, but the details are still being worked out. I was inspired to work on this issue by a staff member in my Albany, Georgia office whose daughter had end-stage renal disease and subsequently had a successful kidney transplant in 2015. Look forward to working with all of you in the days, weeks, and months ahead to ensure that these important transportation services are protected now and into the future. So I thank you for allowing me to appear before you this morning.
I thank the gentleman. So you want us to look into a permanent fix, basically?
Yes.
All right, we'll certainly look into it. Thanks a lot. Thanks. And now we go to Mr. Westerman.
Chairman Pallone, Ranking Member Walden, thank you for hosting today's member hearing. I appreciate the time that you're giving to members like me who are not on this committee, but who share your concerns and wish to be involved in reforming issues related to the Energy and Commerce Committee. As a bit of background, I represent a very large rural district in the 4th District of Arkansas. My constituents are hardworking men and women who love our country and are busy raising families and trying to make ends meet. Our current system of health care is failing them. As members of Congress, with the ability to address this broken system, we are failing them every day we do not take action. Health insurance premiums are spiraling out of control. Patients can barely afford essential medications that keep them alive, and costs to obtain care are outrageously unaffordable. Furthermore, access is limited. Individuals in my district must often drive hours just to get basic medical care because local providers are out of network or because telemedicine is not an option. Our healthcare policy and delivery system affects everyone. Most people don't give a lot of thought to healthcare when they don't need it, but when they do, it's all they think about. In the United States of America, we can do much better in healthcare. We can cover more people, we can cover pre-existing conditions, we can lower costs, and we can provide Americans with more options, transparency, and the best care on the planet. We're all quick to point out the problems, but I'm here today hopefully to provide solutions. I'm not a doctor, I'm not a pharmacist or an insurance actuary, though friends of mine who are experts in those fields do serve in Congress and bring much to the table. I'm an engineer. I was educated to approach problems logically, methodically, and with common sense and reason. When the American Health Care Act and its Senate counterparts proved unsuccessful to address our nation's health care crisis, I thought, why leave the heavy lifting to the traditional healthcare policymakers? Might a fresh set of eyes make a difference? Might a different approach be something that we need? With that mindset, I set out to develop a bipartisan healthcare bill that would provide the people of this nation with some relief, and I spent a year and a half doing a deep dive into the policy. The Fair Care Act, which I introduced earlier this year, can be the bipartisan framework to our nation's healthcare crisis. In it, I address public and private payers, drug prices, provider competition, and healthcare innovation. My legislation would increase access to insurance provided on the ACA exchanges, create competition between providers and drug makers, and ensure long-term solvency of the Medicaid program without abandoning those who are currently covered. It would continue to cover patients with pre-existing conditions, and states would have increased opportunities to design health care programs that meet the unique needs of their population. And please, before you assume that a Republican from the South couldn't possibly introduce legislation with provisions from both parties, familiarize yourself with its content. For example, the bill limits the exclusivity period for certain drugs and biologic products. I see that Representative Schakowsky is here today. She and I have already introduced a bipartisan bill to address that particular issue. It reforms payment structures for Medicare Parts B and D for wealthy individuals. It creates fair access and reduces income cliffs so more individuals can afford to enroll in insurance plans. It reestablishes antitrust laws that apply to health and dental insurers. It holds pharmacy benefit managers accountable for their actions, discourages hospital consolidation, and increases transparency throughout the system. Plus, it does a whole lot more. I've developed this legislation from my personal convictions as well as evidence-based research about what is best for the greatest number of Americans without the influence of interest groups, lobbyists, or enterprises. We have a choice as lawmakers, as representatives sworn to serve our constituents. I've found that the healthcare problems are not unsolvable. We can either fight and bicker about trivial political matters, or we can work together to make progress and actually address the healthcare crisis. Waiting till the next election cycle doesn't help the American people. Waiting for the system to collapse doesn't help the American people. Working together on real solutions does. I bring this legislation to you today in the hopes that it will serve as a starting point for objective discussions and legitimate negotiations on these issues. I'm willing to meet with any of you to discuss working together, and I sincerely hope that we do. Healthcare cannot and should not be a political issue if we truly hope to help all Americans. Again, I thank you for this opportunity today, and I would welcome any questions you may have.
I want to thank you and assure you that we will look into your bill. And I do want to say, it really drives me crazy, and members have heard me say it many times in this committee, that we have these disparities between rural America and the rest of the country. I mean, it just should not be that, you know, if you're in a rural area that you can't get, I'm not saying it's always true, but that you often can't get access or quality health care or resources. You know, I've had a chance over the last couple of years because my son was in Japan in a rural area teaching English, and I was amazed how it didn't really matter whether you went there in this small town 1,000 miles from Tokyo or you were in Tokyo. You basically had access to the same level of care, and it's just not true here, and we've got to do something about it. Did you want to?
No, I just want to thank the gentleman from Arkansas and also concur with you, Mr. Chairman, on the disparity in access to care. I've got 3 counties with no hospitals and no doctors because they're so remote. 1 person for every 9 miles of power line. So, I mean, these are wide open spaces, and yet when a heart attack or a stroke occurs, that golden hour is the same length of time as it is in an urban setting. So expansion of telehealth is essential, and these basic services. But I know Mr. Westerman has worked really hard and put a lot of thought into this plan, and I hope there is an opportunity we can dig into it a little further, because he's really worked on this for a couple of years now. So
I appreciate that, and I believe it's policy that works for rural America and urban America.
Ski?
Yes, I just wanted to thank the gentleman. I'm so happy that we're co-sponsoring a bill to lower the price of prescription drugs, and it's an honor to be working with you on that. Thank you.
Thank you.
Thanks again. We appreciate it.
Thank you.
Gentleman from California, Mr. Liu, thank you for being here.
Thank you, Chairman Pallone, Ranking Member Walden, Chairwoman Schakowsky, and Ranking Member Morris Rogers for allowing me to testify. Today, I'm here to urge you to consider my legislation, H.R. 3570, the Therapeutic Fraud Prevention Act, which aims to prevent for-profit conversion therapy. This legislation has already been co-sponsored by 89 of our colleagues, including 14 members of the Energy and Commerce Committee and 6 members of the Consumer Protection and Commerce Subcommittee. It is supported by a wide range of organizations, including the American Academy of Pediatrics, the American Psychoanalytic Association, and the Human Rights Campaign. When I was in the California State Senate, I authored the first law in the nation to ban gay conversion therapy. Since then, 18 states have banned this practice, and this is a bipartisan issue. In 7 of those states, Republican governors signed the legislation, and in a number of those states, the state bill had bipartisan support. Now, conversion therapy has 3 main problems. Number 1, it doesn't work. It's fraudulent. Number 2, not only does it not work, in some cases it could severely harm the patients who undergo it. And number 3, it could be very costly. According to Williams Institute, nearly 700,000 folks in the United States have been subjected to conversion therapy, and one group known as Jonah was charging about $100 for weekly individual sessions. A lawsuit filed by former victims of Jonah, represented by the Southern Poverty Law Center, revealed that individuals could spend more than $10,000 per year on conversion therapy. Jonah was ordered to shut down in 2015 for violating New Jersey's Consumer Fraud Act. So in addition to being costly and being fraudulent, we know that the entire medical community is arrayed against this. The American Psychiatric Association has said that no credible evidence exists that any mental health intervention can reliably and safely change sexual orientation, nor from a mental health perspective does sexual orientation need to be changed. There is simply no disease known as being gay. It's simply being human. That was removed out of the DSM-IV manual decades ago. So when a for-profit mental health professional comes and says, I'm going to charge you money to get rid of a disease that does not exist, that's called fraud. In addition, studies have shown that patients can undergo severe harm from this. Patients have committed suicide or thought about committing suicide. When I did this legislation in California State Senate, we had witnesses come up who talked about going through this practice and then wanting to commit suicide later. So this can also greatly harm people. I also want to note that this legislation that I introduced here only applies to for-profit conversion therapists. So if you're a priest and you want to talk about this with members of your church, that's fine. It doesn't apply to you. It applies to these groups that are scamming consumers with this fraudulent practice. I note that this bill will protect individuals from being defrauded by conversion therapists and falls clearly within the subcommittee's mission to protect consumers. So I respectfully request that either the subcommittee or the entire committee consider this bill. And thank you for the opportunity to testify, and happy to answer any questions that you may have.
Thank the gentleman. Again, we will take a look, and we certainly are always concerned about anything that relates to consumer fraud and trying to prevent consumer fraud. So unless anyone else, I thank you again for being here. We'll follow up.
Thank you.
Thanks. And next we go to the... Wasn't she here? Okay. Gentleman from Wisconsin is next. Thank you.
Right, voted for one of your nice amendments yesterday. I'm here to talk about HR 380. It deals with requiring that, well, right now when it comes to dams, environmental agencies frequently feel that we need fish passageways so the fish can swim upstream. We have a major dam in the state of Wisconsin, which is actually in Congressman Pocan's district, but it's kind of very close to my district. And right now, that dam is the only thing that prevents Asian carp, a huge invasive species, from swimming upstream in the Wisconsin River. It's a very important thing to the state of Wisconsin. The Asian carp have gone all the way from the Gulf of Mexico into the Wisconsin River, which is the most important river in the state of Wisconsin. The Wisconsin River is not only important in its own right, but it's, as you work your way up the river, you wind up in many, many lakes in northern Wisconsin. The only thing that's prevented these massive Asian carp from doing so much to destroy the upper Wisconsin River and lakes in northern Wisconsin is a dam on the southern Wisconsin River. Right now, the Secretary of Interior is doing a study to see whether they can put a fish passageway up there. I can understand why in most circumstances you want a fish passageway. I can think of other examples in other parts of my district where they work well. However, in this era of invasive species, some of these dams are so valuable in protecting our rivers and lakes. And for that reason, myself, with the assistance of Mr. Pocan, we drafted a bill requiring the Department of Interior to look at it. And I think if we do, we can rest easy in knowing that not only the upper Wisconsin River, but all the lakes in northern Wisconsin can be protected from the Asian carp. I'm sure there are other places around the country where this must be a problem as well. Have any questions for me?
Well, I just want you to know that we worked with you and Mr. Pocan on this in the last Congress, and we'll continue to work on it. I just want you to know that. Yes, Mr. Upton.
Well, thank you for being here today. I know that as a member of the Great Lakes Caucus, I think you are too, that fighting the Asian carp from getting further north is a tremendous priority for all of us. And we had a bipartisan group from Michigan go down to Illinois during the 4th of July break to look at one of the locks down there, just literally about an hour south of Midway Airport. And the Corps of Engineers, as you know, has come up with a study that I think we need to implement that would block that carp then from going north and infiltrating, causing irreversible damage to the Great Lakes region. And it appears as though it's going to be a bipartisan effort. The Corps assured us that they were on board to try and do this, but appreciate your commitment and your work and your interest, and there's a lot of people that are on your side.
Yeah, I should point out that not only is this important for the Wisconsin River, but it's important for all the Great Lakes, because near where this dam is, the tributaries that flow into Lake Michigan go there as well. I mean, it's right on the Continental Divide, and a lot of people feel that if the carp got north, it wouldn't only affect lakes in Wisconsin, but it'll work its way into Lake Michigan.
Thank you.
I thank the gentleman, and we'll work on it again.
Thanks much.
And now the gentlewoman from New Mexico. Thanks for being here.
Thank you, Chairman Pallone. Thank you, Congressman Upton, and members of the Energy and Commerce Committee. It is an honor to get to speak with you today about the issues relevant to New Mexico's 2nd Congressional District. I first want to applaud the Energy and Commerce Committee's work to lift up rural and underserved communities. Our rural communities are important threads to the fabric of our nation. They provide the food we put on our tables and the energy that powers our day-to-day lives. More importantly, they represent the American values and traditions that are at the heart of who we are. I love our values and way of life, but our rural communities are facing increased hardships like never before. Since I was sworn in, I visited all 19 counties in New Mexico's 2nd Congressional District. And in each place I visited, residents voiced the same message. They want the same economic opportunities and healthcare access that cities and suburbs have. These are the issues I came to Congress to tackle, and it is why I am here today speaking before the committee with broad and far-reaching jurisdiction to address these problems. When meeting with my constituents, access to basic health care leads nearly every conversation. Because in southern New Mexico, it's not just about health care affordability, it's about health care accessibility. I have met expecting mothers who have to drive for hours for every single prenatal appointment. I have met veterans who have to get on a bus in the middle of the night to get to a doctor's appointment in Albuquerque the next day. I have met with teenagers in the midst of a crisis who face a long waiting list for a much-needed mental health appointment. And I have visited rural and community hospitals on the verge of closing. These are daily challenges for the 6 million Americans living in rural communities. I'm by no means an expert, but I think it is clear that one way to increase healthcare access in rural areas is increasing the number of doctors serving in them. In March, along with a bipartisan group of colleagues, I helped introduce the Resident Physician Shortage Reduction Act of 2019, H.R. 1763. This bipartisan legislation takes critical steps towards reducing nationwide physician shortages, with an emphasis in rural areas, by increasing the number of Medicare-supported residency positions by 15,000 positions. H.R. 1763 already has 139 co-sponsors, including 16 members of this committee. I strongly encourage the committee to support this bill. Similar in mission, I also helped introduce the Training the Next Generation of Primary Care Doctors Act, alongside Representative Ruiz in May. H.R. 2815 reauthorizes and expands the Teaching Health Center Graduate Medical Education Program. The program has helped address physician shortages in low-income regions of the country, such as the district I serve, because many medical students go on to serve the communities where their residency program was located. In the 2018-19 academic year, the THCGME program supported the training of 728 residents in 56 primary care residency programs across 23 states. These graduates are almost 3 times more likely to remain in primary care practice than traditional GME graduates, almost 2 times more likely to practice in underserved communities, which is most of New Mexico, and more than 2 times more likely to serve in rural America. The THCGME's program success thus far helps meet this mission, and I will continue to advocate for its expansion. Other issues that impact New Mexico include transportation. We have transportation programs that help rural residents get to their medical appointments, and we've seen that that helps everyone's health. We've also seen the devastating impact that high drug prices have, and we have an obligation to address them. Let's keep building on the momentum of the legislation passed in June and continue putting forth measures to protect our constituents suffering from inflated and unregulated drug prices. Members of this committee, even with the hardships rural communities face, we are often the first to be forgotten when legislators and healthcare experts discuss healthcare quality, access, and affordability. Thank you again, Chairman Pallone and Ranking Member Walden, for holding this hearing and for your work delivering better healthcare to all our constituents.
I want to thank the gentlewoman. You know, what you said about training people and then they're staying in the community is so true. And, you know, I've seen that. You know, one of the things that we did when we did the, I think it was in the ACA, that we said that you could get additional slots for, you know, for residency programs if you set it up at a community health center. And because they were outside of the regular system. And I saw that, I can't remember what tribe it was, but we were on the Puget Sound, I guess, in Washington State, one of the tribes, and they had actually done that with their Indian Health Service, where they had set up a residency program, and they just got the additional slots without having to transfer or buy them anywhere. And they said in almost every case, the doctors that were trained there stayed, you know, with the community health center or with the tribe in that area. And it's true. I mean, if you have those training programs in those underserved areas, people tend to stay there. It's just a reality. So the other thing that the gentleman from Arkansas mentioned is trying to be innovative with technology too, and telemedicine, which is important. So we'll definitely look into it. Thanks again. Thanks. And next is the gentleman from Minnesota, Mr. Phillips.
Thank you, Chairman Pallone, Mr. Upton, members of the committee, for the invitation to speak today about some important issues facing my community. Minnesota is fortunate to be home to many pristine waters and natural treasures, including the Mississippi River, our infamous 10,000 lakes, and those are just ones with names, and the Boundary Waters. The Boundary Waters is the most visited wilderness in our country, and a special place for Minnesotans and many throughout our nation. People from across the world also visit to canoe and hike and to fish. In May, the Department of the Interior decided to renew 2 mining leases for a proposed copper sulfide mine right on the edge of the Boundary Waters, despite scientific evidence, economic data, ongoing litigation, and a public record of opposition dating back over 50 years. This unilateral action from the Trump administration to move forward on the copper sulfide twin metals mine is irresponsible and unacceptable. We must continue to protect our public lands and waters and ensure that Minnesota's and the nation's wilderness areas can be enjoyed by future generations. Minnesota's 3rd district is home to one of the most visited lakes in our state, Lake Minnetonka, made famous by Prince's movie Purple Rain. I'm sure that's the first time that's been uttered in this room. Right now, Lake Minnetonka and the rest of our state's waters face the grave threat of aquatic invasive species, something to which my colleague from Wisconsin referred to just moments ago. Aquatic invasive species include Asian carp, spiny water fleas, and zebra mussels, none of them native to Minnesota, and all of which cause major harm to our water's ecosystems. These species have been moving throughout Minnesota, clogging our lakes and rivers, and killing off native animals and plants. Life in our district revolves around these lakes, so this problem is of grave concern to our community. In June, I convened a roundtable of local experts to discuss the threat posed by these invasive species, and the consensus was very clear. Congress must invest resources and support state and local governments to prevent the further spread of invasive species in our lakes and our rivers. And unfortunately, the problem of aquatic invasive species is exacerbated by our changing climate. Invasive species can now live in waterways that were uninhabitable just a few decades ago, while native species are struggling to adapt fast enough to compete with them. Climate change is right in our backyards, and it is time to act. I hear it from my constituents every day, middle and high school students in particular, who contact my office to express their distress that our federal government has refused to take bold steps or any meaningful action to solve this issue. These young people are motivated to organize and contact their representatives because they feel it is their only option. Their life and future depends on it. And I also hear from their parents and their grandparents, worried about the world they will leave behind for their families. Climate change is complex and requires a multi-pronged approach. We need to consider solutions and policies like federal support for research and development of renewable energy, extending and supporting new tax credits for renewables, supporting consumer purchase of electric vehicles, and other thoughtful proposals. Another policy we need to explore is placing a price on carbon, like the Energy Innovation and Carbon Dividend Act. This legislation places a fee on fossil fuels at the source, beginning at $15 per metric ton of CO2 equivalent emissions, and steadily increases annually by $10 per metric ton. The fees would be deposited into a carbon dividend trust fund and allocated as dividend payments to all U.S. citizens and lawful residents. Thus, the bill would use market forces to provide incentives for the reduction of carbon emissions. This is an achievable solution that both parties can support and should, and I urge all who are present to consider doing so. The American people have sent a clear message to Congress. Please take action on climate change. And I hope you'll join me in doing all that we can to keep our planet safe and prosperous for generations to come. Thank you, Mr. Chair.
Thank you. And I did want to mention that just this week, myself, Mr. Tonko, and Mr. Rush, we made an announcement earlier this week that we were going to try to achieve a goal of 100%, I guess I'll say carbon neutral by 2050, and that we were going to begin a series of hearings, which actually started yesterday in Mr. Tonko, the Environment and Climate Change Subcommittee, to see what legislative proposals that we have before the committee or others, with the idea that by the end of the year, if not sooner, we would come up with legislation, sort of a climate action plan, if you will, that we would then try to sell to the rest of not only Democrats, but Republicans as well. So we certainly want to look at your proposal in the context of that, and we will.
And Mr. Chair, if I might say, we're in this together, and to the extent that we can identify best practices as practiced by other countries, in many cases ahead of us on this issue, I would encourage.
Right, and it's true. We mentioned that, the scientific community basically says that by 2050, if we don't take action now to get to carbon neutral by 2050, we're going to have a catastrophe.
Indeed.
And several countries have used that date, France, Germany, Japan, and others. Did you want to?
I just want to say thank you, Mr. Phillips, for being here. And I know Minnesota is known as the land of 10,000 lakes. Michigan has more.
I knew that was coming.
But last year I went down the Paw Paw River, which is merges into Lake Michigan, and when you take the jigs and jogs, you go about 35 miles inland from Lake Michigan, and you actually get 100 miles of river because it goes like this. And we were working on identifying the lamprey eel larvae and eggs. And that's how far we went up to look at the lamprey side that then forced the younglings of the lamprey eels to surface, and then we're able to collect. And of course, that has been an issue that we've had in the Great Lakes for
long time,
many decades, and that's why it's so important as we look at Asian carp and other invasive species. It came in maybe with ballast water, I think, with with those eels, lamprey eels, but it's a tremendous impact on the fisheries and tourism and everything else. And when you look at zebra mussels as well, a huge issue for all of us.
Huge. Thank you.
Thank you. Thanks
Thank you, Mr.
again. Appreciate your being here. And we now go to the gentlewoman from Ohio, chairwoman of the Energy and Water Probe Subcommittee, who we've worked with on quite a few issues because of the overlap between your Appropriations Subcommittee and this committee. Thank you for being here.
Thank you, Mr. Chairman and members of the committee, and I want to thank you for your openness to working across committees to even do greater things for our country, Chairman Pallone. It's a real honor to be before you today, and I want to thank Ranking Member Walden and all members of the committee for the opportunity to address you this afternoon. I see my great friend Fred Upton from our sister Wolverine State up there, and it's wonderful to have you there as well. As chair of the Energy and Water Appropriations Subcommittee, I deeply value the collaborative relationship and consultation between our two subcommittees, and I believe we can accomplish so much more working together. In addition to my verbal testimony, I also have highlighted several priorities that relate to the Health Subcommittee in my longer written testimony that I will submit. But I want to concentrate on three areas this morning. I know you were really busy last week in several areas of overlapping jurisdiction, but the three I want to talk about this morning are workforce development, weatherization, and energy efficiency at our drinking water and wastewater treatment plants across this country. I want to applaud, first on workforce development, Chairman Rush and the full committee for your attention to the workforce development and pipeline issues at the Department of Energy. Last week, you approved H.R. 1315, the Blue Collar to Green Collar Jobs Development Act of 2019, and in March of this year, our Appropriations Subcommittee on Energy and Water also held a workforce development hearing. We have a lot of work to do together on this one. As you know, our nation has a serious pipeline and workforce development crisis in the energy and nuclear security industries, both at the Department of Energy as well as in the private sector. According to the Energy and Employment Report for 2018, roughly 12% of today's energy workforce is eligible to retire. We're talking about hundreds of thousands of people. And 70% of industry employers in energy report hiring difficulty. I hear this over and over and over again, whether it's electrical engineers, whether it's nuclear staff for our nuclear power plants. In STEM fields, our nation is not meeting demand. The Department of Energy must be more proactive about recruiting and training a new generation of innovators because our country needs to compete in a new world economic order in which our nation is skills short. I believe that we need to be as aggressive as members of Congress in exploring how to create this more aggressive recruitment opportunity. in the same way as we do when we select individuals from our district, working with our service academies to move young Americans into fields and into places that perhaps they hadn't imagined when they were much younger. But I don't think we're going to meet the demand based on current trends, and I would be more than willing to work with this excellent committee on that workforce development issue, fully engaging the Department of Energy in that effort. Number two, I want to focus on weatherization, and I can't thank your committee and subcommittees enough for recently approving H.R. 2041, Representative Tonko's Weatherization Enhancement and Local Energy Efficiency Investment and Accountability Act. The Department of Energy's weatherization program has a direct positive impact on the lives of everyday Americans, and it is a great training ground for people going into the various specialty sectors in the building trades as well, particularly drawing in low-income Americans spanning all 50 states, our territories, and our Native American tribes. H.R. 2041 expands flexibility for the program and creates new opportunities to innovate, and I hope to work with your committee to ensure we can get a floor vote on the weatherization reauthorization. In addition, I hope we can work together to add language to encourage initiatives that encompass neighborhood-scale weatherization. I think we have to tiptoe our way into that one, but the Innovation Fund encourages innovative roofing, energy efficiency, and new outreach and assistance programs, and I would like to provide slightly more clarity to the Department of Energy on this front. This is an older program that operates well. The states are fully engaged, and I think we can give them a hand up by augmenting that particular language in the bill. Specifically, the legislation, I believe, should include, within innovative outreach, a neighborhood-scale weatherization. At the ground level, community action agencies work seamlessly between various federal programs, and I'm on a mission to ensure that other federal agencies, including HUD, the Department of Health and Human Services, and the Veterans Department, collaborate with the Department of Energy to ensure that these programs work together more seamlessly for maximum impact at the neighborhood level. And finally, on energy efficiency at drinking water and wastewater treatment plants, the largest segment of most cities and large regions' electric bills or power bills come from their having to provide their drinking water and wastewater treatment facilities with regular power. We have important work to do in making our wastewater and drinking water facilities more energy efficient. In many cities, as much as 30 to 40% of their entire power bill attends to operating those facilities. On behalf of ratepayers, consumers, and the general public, we have a major role to play. We need to focus that a bit. I'm glad to see the Energy and Commerce Committee is continuing to take decisive action to improve the lives of the American people across our nation, and I want to thank you for the opportunity to highlight some of these issues of concern to our committee, and want to thank again the Chairman and Ranking Member for the opportunity to testify.
I want to thank the gentlewoman and, for continuing to work with us on common issues between your subcommittee and our committee. The energy weatherization package that we did pass out of committee, we expect to bring that up fairly quickly on the floor, when we come back in September. I know we're running out of time, but you had mentioned to me about an initiative that was similar to the service academies, but you didn't get into it. What was that idea again?
Well, I'll tell you, I'm getting frustrated in going around to our national labs.
Oh, it was on the labs, right.
And looking at also the private sector that comes into the labs and listening to what they're saying to me about the lack of talent from our country that is available to hire. You know that in most of our labs, we must hire American citizens to do work. And
so you want to do something like the service academies with the labs, right?
I've been thinking about a model, and again, I don't have it all thought out, but I know how much our office is involved in, as I'm sure yours are. Every year we select a certain number of individuals and we nominate them for West Point, Annapolis, the Air Force, the Coast Guard, the Merchant Marine. And we work with the Department of Defense on that. And I'm on the Defense Subcommittee. We every year have the heads of these academies come before us And we have a very aggressive recruitment. And I believe we need to do the same in terms of the STEM fields for these jobs. We simply do not have enough people coming into the nuclear power industry, for example. And I went to one of the lab showcases here on the Hill yesterday. We're talking about thousands of jobs that are unfilled, that must be filled by American citizens. And I don't have the magic answer. I'm not the
Well, get back
authorizing.
to us, yeah.
I'm not the authorizing committee, but I would love to explore with you a better model
Please.
to move the Department of Energy into more aggressive recruitment. Maybe we work with the labs. Maybe my subcommittee has to provide money that would provide for the education of these individuals. Many who go into electrical engineering, by the time they get to the junior year, they go, hey, I can make more money in business. Why should I be going into debt, to go into electrical engineering?
Well, get back to us and we'll work on some initiative.
Thank
all
you,
right?
Mr. Chairman. Thank you very much for your openness to that.
Mr. Upton?
I just want to say thanks for being here. As you know, these bills that you referenced, workforce development, particularly on weatherization, they were strongly bipartisan. I will tell you in advance that we did raise the authorization levels higher than they've been before, so you are now in a perfect position to fit that within your subcommittee along with nuclear waste. So I look forward to working with you on that as you come back to us in September on the floor and yield back.
Thank you, Ranking Member Upton. Thank you so much.
All right, thanks a lot.
Just for the record, this year we were able in the House with bipartisan support to move the appropriated level for the weatherization program from about $254 million to $290 million. And I don't know what the Senate is going to do, obviously, but we are serious about aggressively modernizing this program. It has a terrific track record in the states, and we can do so much more. And if I could just move on a side road just a second here. Yesterday, again, in going to a weatherization display here yesterday from many, many communities, it became clear that the workforce development pathway from these various weatherization programs so people can get training and go into the various trades is not so streamlined. And I'm very interested in how to use these weatherization programs to identify talented people around the country who can be skilled up to do jobs that are needed in every single trade, craft around this country. And I think this can be one of the feeder programs if we are more focused on it.
All right, thanks a lot. You should know that Mr. Rush, she started out by praising you, just so you know.
Well, thank you so very much for praise. I have to give some of the credit for all that she said to her. She's my my neighbor in terms of where our offices are located. She's been my co-collaborator for a number of years on many policy issues. She has been my co-conspirator when we have to conspire against the interests of leadership on many occasions. She's really been a spiritual ally of mine on so many, many occasions. And she has come into my city and my district on many occasions because, in Chicago, the largest community of Polish American citizens are located in Chicago. So she's been such an eminent friend of mine and been such a wonderful, wonderful and true friend. So I really want to welcome her here before us. I want to also just say that in regards to weatherization, one of the amendments that we passed in the bill that we just marked up and passed out of the full committee amends weatherization program to allow for training of community residents that when the local areas that the weatherization dollars are being spent, then they are mandated to train and hire community-based residents for those programs. So it's in line with the spirit of what you have been discussing, and you mentioned the workforce development areas, and we thanks to in the bipartisan some way, thanks to our eminent ranking member of the Energy Committee, Mr. Upton. We have, and under the leadership of Chairman Pallone and ranking member, the ranking member, we have been able to come up with some significant legislation as it relates to workforce development. We call it from green jobs and blue and green jobs. And it just will impact those out of work coal miners and minorities and women and veterans. It's a real broad, comprehensive bill that will try to amp up our workforce in the whole energy sector. And so I'm just excited to work with you and with others as we embark on this place of using the national labs and others, other Department of Energy, some of this program, to really create opportunities for Americans who need work, and need quality work, and need fulfilling work, and need to have a living wage while they're working and be able to take care of their families. So, Marcia, your spirit permeates a lot of what we do. And so I'm just so pleased to have you with us. I'm pleased to be your friend. You know, I recall some years ago when you and I created a caucus. Jobs Now caucus. You know, the Jobs Now caucus was way out in front of a lot of these things that we are discussing. So again, thank you for your stellar work and for your involvement.
Thank you. Thanks, Bobby. I saw that you got, I knew when you mentioned anything about nuclear that Mr. Shimkus was going to get all energized here, so I'll recognize the gentleman.
Thank you, Mr. Chairman. I'll be brief. I appreciate all my colleagues being here, and as the Chairman Capter knows, I attended her member day. And she knows that, as I know, that there's 39 states, 121 locations. We have a law, an authorization law on the book that the appropriators failed to fund. Bipartisan failure to fund. As we talk about the Green New Deal or the Chairman's zero in 2050, nuclear has to be part of that portfolio. It's only going to be around here longer, and we have to address the waste. So I would just respectfully plead with the Chairman to help us do this, because we need to comply with the law, and we need to finalize this. So for the 39 states and 121 locations that in places like, I know Sean from the Chicagoland, I know Levin's in the back row. We've got these places on major waterways, lakes, streams, in environmental sensitive areas that I'm just pleading with the appropriators to help us do the right thing and follow the law. And with that, Mr. Chairman, I'll yield back.
Thank you. As you can see, Marcy, you created a lot of interest here, needless to say. So.
Well, Mr. Chairman, if I could just say to first Mr. Shimkus, believe me, we have heard you. We have heard you. I represent a state that has several power plants that have waste on site. So Ohio just passed special legislation to allow those plants to continue in operation. Other states have chosen other options. We have a serious challenge in the nuclear industry in this country. I honestly believe it should not have been bucked to the states. I think there should have been a federal financing solution. It was not done by this administration, and shame on them. And so the states have had to struggle. So I share your concern about nuclear. I understand what you're saying about the waste. I hope to be someone that contributes to a real solution here that is both practical from an engineering standpoint, but also politically realizable. And I think we have to keep pushing. No one has been a stronger advocate than you have, and we welcome you anytime before our subcommittee as we struggle with this very, very important issue. So you have been heard, and I admire your work. I want to say to Congressman Rush also, you are my Great Lakes buddy. You are my great, great friend and advisor from the city of Chicago, which needs our attention, but also across the country for the needs of those whose voices here are limited. And I reciprocate the admiration. So,
Thank you.
Thank you. And Congressman Tonko, I also complimented before your arrival today and mentioned the bill that you worked so very hard on, along with Congressman Rush, and I thank you for your leadership in moving this forward. And thank you, Mr. Chairman.
Thank you. Thank you, Chairwoman. Appreciate you being here and all that you said. Now, I have to say, we're a half an hour late, and I don't want to keep holding everybody up. So what we may do is go back to what we were supposed to do and not even ask questions or make any comments at all. So I may just go through the next 5 or 6 and ask everybody not to even comment on what you say, which I hate to do, but otherwise we're never going to get through it. So next is the gentleman from Illinois, Mr. Koski. Although I do have to say he's a Middlebury graduate.
Thank you, Chairman Malone. I will do my best to be very boring. Chairman Pallone, Chairman Tonko, the members of the committee, want to first really thank you for giving this opportunity today. Share the thoughts on as you think about your priorities as Congress. Chairman Tonko, your subcommittee, I would submit to you, is the most important subcommittee in Congress right now. The work that we do in this Congress is going to be pivotal to determining whether or not we survive as a species. I do not say that lightly. The climate crisis is existential. I greatly appreciate your leadership, Chairman Pallone's leadership in addressing this crisis head on. I've been encouraged by your work to hold this administration and the EPA accountable for upholding existing climate policies, including CAFE standards. I thank Chairman Tonko for his work developing your climate principles this past week, which is an integral first step towards finding consensus within our own caucus and across the chamber. And I believe the document lays out many important ideas currently missing from our conversations regarding climate policy. If we are going to address the climate crisis, we have to acknowledge a couple facts that may be politically difficult, but that doesn't mean we can duck them. The first is that the climate crisis is urgent. We do not have time to debate settled science any more than we have time to debate gravity. It is real, it is now. Every day that we fail to act, the consequences of our inaction become more costly and more dire. History is going to judge us not by how we message to our political base, but to how we rose to this challenge. However, that does not mean that the necessary changes in our energy and environmental policy are going to be simple. Our standard of living, our economy, our social safety nets, and our government itself depends on energy access. It is the height of naivete to assume that the changes we have to make are going to have simple little fixes. We can't allow ourselves to be deluded into thinking that just because the problem is urgent, any solution will suffice. If we ignore the urgency, it's suicide. If we ignore the complexity, it's irresponsible. So we have to account for both. We can't just issue edicts from on high, but we also can't shy away from expertise. We cannot act with the purpose of scoring easy political points. That may feel good, but we do so at our own peril. The urgency of the crisis demands we act with serious determination and in a measured and deliberative manner that is not inconsistent with urgency. So if I can only persuade you to do one thing today, please unleash the nerds. Those nerd-driven solutions may not be exciting, they may not be sexy, they may not have a great little sound by them. They may not solutions would build on policies that are already working. CAFE standards have helped increase the average fuel economy of our light-duty vehicle fleet. I hope this committee could encourage policies like a fee-based program that would build on that success by rewarding consumers who buy more efficient, cleaner vehicles. The committee should also consider complementary policies to help get less efficient vehicles off the road. Many, many years ago, I did some work for California. We found that the single most cost-effective they could do would just pay everybody with an old Dodge Dart $10,000. We can get those clunkers off the road and make a big difference. Other climate policies have broad bipartisan support. I think members of both parties have agreed that we should prioritize the deployment and development of grid-scale energy storage technologies. Those technologies will not only lower energy costs for consumers, but make our grid more resilient and efficient while lowering greenhouse gas emissions. That's why I was proud to sponsor H.R. 2909, the bipartisan and bicameral Promoting Grid Storage Act, alongside many members of the Energy and Commerce Committee, and I'd urge this committee to take up and pass the measure. There are other solutions that require that we look back at existing laws with renewed scrutiny for how they worked in practice. The Federal Power Act, for instance, makes it clear that FERC should ensure that electricity rates are just and reasonable, and yet rates across the country fail to account for the cost of carbon pollution. FERC has been hesitant to address that massive externality because some there believe they don't have the authority. I disagree. I don't think it's what Congress intended. I think the deregulation of energy markets did not mean that we still don't have social obligations to set prices that account for externalities, and we need to say so, and we need to say so loudly. Now, to be clear, economy-wide measures need to be taken to address the full scope of the issue, and these policies should be technology neutral. They need to put the goal of reducing CO2 above the path of how we get there, and they need to embrace climate action as a once-in-a-generation investment opportunity. I've spent 20 years in the clean energy space. I've built over 80 projects in 30 different states. Every single project that I built lowered CO2 emissions and saved money. With one exception, none of my clients ever did those projects because they were as passionate about climate change as I was. They were greedy. In Washington, to invest, I've invested about $300 million. If we view that from a lens of Washington, that is a cost we have to score and figure out how to pay for. Outside of Washington, that's an investment opportunity. Let's embrace it as that investment opportunity. Let's use this to grow the economy. And to be sure, not all these solutions are within the jurisdiction of your subcommittee or even the broader committee, but each illustrates the kind of tasks we need to be willing to take on if we are going to address the climate crisis. The task is urgent, the task is complicated, and I hope the committee will consider some of the proposals I've mentioned here today, along with about 3,000 others that I'm working on. And I look forward to working with any and all of you in any way I can to help combat the crisis. Thank you again for having me today, and thank you so much for your leadership.
Thank you, Mr. Casson. It's hard for me not to issue questions because you raised a lot of points, but I got to move on. So thanks again. Appreciate it. Now, the way this is set up, Ms. Slotkin should be next, but I'm told, Mr. Levin, you have a markup that's occurring right now?
Yes, sir.
Would you mind, Ms. Slotkin, if we let him go back to his markup and then we'll go to you? It's okay? All right, go ahead, Mr.
Thank you, Mr. Chairman. I very much appreciate the opportunity to be here. Thank you to all my colleagues and friends who are on this committee. Some of the top priorities that I hear about from my constituents in Southern California are issues that come before this committee, so I'm grateful for the opportunity to raise their voices here today. One of those priorities that I hear about from my constituents is the need to move the spent nuclear fuel in our district at the San Onofre Nuclear Generating Station to a site that is not surrounded by millions of people, threatened by sea level rise, and located near active earthquake faults. It's critical that the federal government establish a consolidated interim storage or CIS facility for this waste and other spent nuclear fuel across the country. I strongly endorse Congresswoman Matsui's Store Nuclear Fuel Act, which would authorize the Department of Energy to take title to spent nuclear fuel in order to store it at a CIS facility. I've also introduced common sense legislation that would prioritize sites like San Onofre that are in locations with high population density and high seismic risk. My constituents are concerned for their safety, and it's long past time that we start moving this waste to a safer location. I urge the committee to prioritize this pressing issue, and I thank my colleagues who are equally concerned. Another issue that I hear about from my constituents is the climate crisis, and we need to take aggressive action that is commensurate with the scale of the challenge we face. The science is clear. Climate change will have increasingly devastating effects on our planet if we do not make significant changes to the way we live. I'm grateful to Chairman Pallone and my friend Chairman Tonko for your continued leadership on this issue, and I look forward to working with you for a long time to come. I'm also proud to have introduced legislation that presents an ambitious plan for transitioning auto sales in the United States to zero emissions. We've got to position the United States to lead the world in clean energy, and that includes clean vehicles. I encourage all of my colleagues to support the Zero Emission Vehicles Act of 2019. I stand ready to work with anyone on either side of the aisle who's serious about combating the climate crisis, and I look forward to supporting climate legislation that comes from this committee, and I'm very grateful for all the work that you're doing. Lastly, I hear from constituents often about the need to lower health care costs and expand access to affordable care that covers people with pre-existing conditions. Nobody I talk to supports this administration's efforts in the courts to destroy the Affordable Care Act and rip insurance from millions of families. Thank you to Chairs Pallone and Eshoo for working to defend the Affordable Care Act and lower drug prices. I believe that as we defend the ACA, we must also work together to improve our health care system to achieve universal coverage. We must also do more to address the substance abuse crisis plaguing our country, and that must include measures to address problems with the addiction treatment and recovery system. Many facilities do amazing work, but there are outliers that do not. It's abhorrent that some treatment centers and recovery housing operators engage in bad practices at the expense of vulnerable patients and residents. This includes deceptive marketing techniques, depriving individuals of needed medication, failing to monitor those who are suicidal or in withdrawal, and evicting vulnerable residents out on the street. I hope this committee will join me in closely monitoring the development of recovery housing guidelines at the Substance Abuse and Mental Health Administration to ensure a robust framework. Additionally, as the committee considers legislation regarding substance abuse disorder, I hope that you will consider ways that we can assist states in their enforcement efforts with an eye towards stronger oversight and accountability so that those in need actually receive the help they deserve and are not taken advantage of. I appreciate the amazing work of this committee in tackling a wide range of issues, the widest range of any committee, and I thank all of my colleagues for their dedication to address the challenges that I've highlighted today. Thank you, Mr. Chairman.
Thank you. And again, I would like to ask you some questions, but we're running out of time, so thanks for coming. And thank you, Ms. Larkin, for bearing with us.
Mr. Chairman, may I just say something on the recovery centers, because that is important, and we spent some time on that, as you know, in the last Congress in developing the Support Act, and I do think that is important. And of course, we had not really an oversight hearing, but it was a hearing on the implementation of cures, because we had a large mental health title in the Cures Initiative. We had SAMHSA here. Unfortunately, that hearing kind of got sidetracked on some other issues, but I would just agree that that is an important topic, and we should be in the lead on that and asking SAMHSA what is the current state of on the oversight investigation stuff. We heard some really tough stories about some of the things that were happening in the recovery centers. We need to be on top of that. We're pumping a lot of money into that. A lot of grants are being made available. We need to make sure we're not hurting people in the process.
Thank you. Thank you, Dr. Burgess, and thank you, Mike. Ms. Larkin.
Thank you, Chairman Pallone and Ranking Member, for the opportunity to testify today on something that is a scourge. I know we are all dealing with it, robocalls. If you're like me and like most Michiganders, you hate these calls. And whether you're a Democrat, a Republican, an independent, I think they drive everybody equally crazy. Everyone has a story about robocalls. I have two. They both relate to the same time period right after I got elected. I went in to meet one of the mayors of our towns, Rochester, Michigan, a wonderful guy named Rob Ray. And it was our first in-call, and I thought, I wasn't even sworn in. I thought he was going to tell me about all the grants he needs and all the information he wanted, and I was ready for a bunch of asks. And I said, you know, if I could do one thing when I go to Congress, what would it be? And he said, stop the dang robocalls. Then I came to Congress, and I was given a cell phone, right? We're all given phones when we become members of Congress. I cannot answer that phone because I am constantly getting robocalls. So I'll see a number, I'm sure like most people here, you'll see a number, it's pretty similar to your number. You think, is that someone calling with something important, congressional business? I cannot answer my phone, let it all go to voicemail because of the robocalls. So I am particularly energized on this issue. Let me just give you some specifics. Michigan, last year alone, we had 1.2 billion robocalls made to us. Maybe because we're a swing state, it's even worse. We're estimating that already this year, 784 million robocalls have been made. It is getting worse. A year ago, we were at a certain terrible number. We are now up 143% in 1 year. And it is important to note that it isn't just an annoyance that we all share. Most of these calls are calling with some sort of scam, right? They're looking for your money. They're looking to lure you into something. Americans lost about $10.5 billion due to robocall scams last year. They prey on the most vulnerable, particularly the elderly. We know that they use the number spoofing, so it looks really close to your number. You think it's someone calling from your neighborhood, someone calling who knows you, but it does cause serious problems in our communities, and many people are like me. They don't answer the calls anymore. So if something came in, a hospital, some emergency happened, how many of us would let that call go to voicemail? And I think it is pesky, but it also is important. So the good news is I co-sponsored the Stopping Bad Robocalls Act. It was a bill that was introduced in this committee, and I co-sponsored it. It passed the House yesterday. I'm thrilled about that. It's a really important first step to stemming the scourge of robocalls. I'm really hoping the Senate takes it up, and I would urge your help in making sure that in this day and age, some of these things that are very bipartisan actually get through. Please keep your foot on the gas on this. And I know there's a number of pending pieces of legislation you're also looking at around these issues. I urge you to take them up. This is something that affects all of our constituents in their daily lives. In an era when sometimes people feel like government can't get anything done, I think this would be a huge positive step that we're actually still working up here. So thank you very much, Mr. Chairman.
And I appreciate your emphasis on the robocalls bill that passed yesterday. We will keep our foot on the gas. There is a Senate equivalent. It's not exactly the same, but we're working with the Senate, and we think we can get this done. So thanks so much.
Great. Thank you,
Appreciate
Mr. Chairman.
And now we go to Mr. Perry.
Thank you, Chairman Pallone and Ranking Member Shimkus, members of the committee and staff. I appreciate the opportunity to testify this morning regarding some of my priorities within the committee's jurisdiction. As the focus of the nation's energy policy has shifted in recent years towards reducing greenhouse gas emissions, the policies pursued have increasingly been to the benefit of the wealthy and politically connected at the expense of the American people. The Solyndra scandal, the various environmental tax credits that go almost exclusively to wealthy individuals, the regulatory effort, and the last administration at the behest of the environmental organizations intend to eliminate the coal industry, etc. Not only do these regressive policies have an outsized impact on the most vulnerable among us, they have significantly degraded the American people's trust in their government. Yesterday's Environment and Climate Change Subcommittee hearing entitled Building America's Clean Future, Pathways to Decarbonizing the Economy was the next step in this disturbing trend. Giving legitimacy to the fringe keep it in the ground movement, that's what that did. The proposed ideas would have crippling effects on the bottom line of each and every one of our constituents while having little to no impact on global greenhouse gas emissions. Despite the usual platitudes about just transitions for affected workers or environmental justice and the like, there was no real answer to how destroying the economic driver of my home state of Pennsylvania, as well as numerous others, could be done in a just manner. Little explanation of how these climate actions would be and could be tailored in a way to create economic opportunity for low-income communities, and even less evidence was presented showing that this would work. Similar environmental policies are currently being pursued in the state of California, and these same promises were made to low-income Californians. The result, according to a study by the Center for Demographics and Policy at Chapman University, and I'll read, in summary, the imposition by the state's Democratic Party leaders of highly regressive climate schemes have engendered disparate financial hardships on middle and lower income workers and minority communities, while providing direct economic subsidies to wealthier Californians in environmentalist strongholds. End quote. In light of these findings, I think it's imperative that the conversation shifts from an all-out attempt to destroy entire industries to a more productive conversation about the impact of such actions on the financial well-being of our constituents, as well as the massive restrictions on personal freedoms required by this type of policy. If the majority is dead set on imposing onerous restrictions on reliable sources of energy, the least it can do is try to blunt the negative impacts to the American people. Yet in many cases, mitigating efforts are being stalled, either through overt action by this committee or a failure to act. Continuing to prioritize the development of intermittent renewable sources through subsidies and incentives comes at the expense of baseload power operators, many of whom have closed their doors. This government intrusion into the market is unhelpful and actually increases emissions where nuclear plants close. The issues of intermittency, frequency, cost effectiveness, supply chain security and integrity, and land use requirements impact on endangered species and environmental degradation is conveniently left out of the conversation about wind, solar, and battery storage. However, these are very real issues and need to be addressed before any attempts to decarbonize the economy are pursued. In the meantime, if the committee wants to take actions that will result in increased renewable generation, not just capacity, it should move forward with the efforts to remove the regulatory burdens inhibiting the further development of the only baseload renewable power source, hydropower. Federally imposed regulatory burdens leave hydropower projects with the longest and most complex development timelines of any renewable technology, often in excess of 10 years, while wind and solar can easily go from concept to development in 2 to 3 years. This disparate treatment of the only baseload renewable source is nonsensical and significantly undermines any regulatory framework aimed at lowering greenhouse gases as it drives private capital away from hydropower projects. These burdens are a major limiting factor on the ability of the industry to expand its footprint. Currently, only 3% of the 80,000 dams in the United States generate electricity, so there is a significant potential growth in the industry if these burdens are lessened or removed. Despite the significant regulatory burden on hydropower and the preferential tax treatment received by wind and solar projects, hydropower still accounted for 52% of all domestic renewable generation in 2018. This is both a testament to hydropower's reliability and a damning indictment of wind and solar power. The playing field could not be more favorable for wind and solar, and yet combined they don't make up a majority of generation. And I'll close with this. Rather than pursuing a policy to replace working power generation with one that continues to fail in the most favorable of market environments, we should be leveling the playing field and allowing the free market to drive down prices and clean up the environment as it has for the past century. And with that, I thank the committee and I yield.
I thank the gentleman. Did Dr. Burgess, did you want to make a point?
Yes, it was this committee, after all, that did pass the Energy Policy Act of 2005 when Joe Barton was chairman, and part of that was loans for the development of nuclear electricity or nuclear power. And unfortunately, since then, we haven't done much with that. In fact, those loans have been changed through subsequent administrations and gone to projects that actually haven't really delivered very much in the way of energy, because they were diverted to renewable energy. I really don't think you can seriously talk about a zero-carbon future, regardless of the time frame, if you do not include nuclear energy as part of your base load, and this committee should remember that. So I thank you for bringing it back to our attention.
And I don't want to belabor the point because I know we got to move on, but we really stressed yesterday at the hearing that, we were technology neutral. We're not, saying that this goal is reached just with renewables. Hydropower is important. We certainly want to include nuclear, carbon capture, so I don't want you to think that we're just saying that this goal has to be reached just with renewables. But I know we got to move on, so thanks again. Next is, yes, the gentlewoman from New Mexico. And I did want to mention, because I know you and your colleague from Kansas, right, are the first American Indian or Native American women, congresswomen. And you may not even mention it, but we are determined that in the fall we will have a a hearing on the Indian Healthcare Improvement Act, because I know that that's a commitment that I made, and I just wanted to mention it to you.
Thank you, Chairman.
So thank you.
Thank you. Chairman, Ranking Member, members of the committee, thank you for the opportunity to testify. My district has over 300 days of sunshine each year and abundant wind resources. That's why I'm working with several of my colleagues on legislation to set a nationwide goal of 100% clean energy economy by 2050. Thank you, Chairman Tonko, for being part of this effort. This will protect public health and our environment, create millions of jobs, and mitigate the impacts of climate change for all communities and all generations, especially those disproportionately impacted. I urge the committee to support this effort broadly and through intermediate steps that will enable the transition to clean energy. The transition to clean energy requires a modernized smart electric grid to increase integration of renewable energy and support adoption of zero-emission vehicles. I urge you to encourage deployment of smart meters and other technologies which make our electric grid more responsive and capable of supporting distributed energy resources. I recommend improving the performance, affordability, and deployment of energy storage systems to enhance grid flexibility and reliability, and expanding advanced transmission technologies to get power to demand centers more efficiently. Improving energy efficiency and transitioning from fossil fuels to electricity are keys to a clean energy future. I urge you to increase energy efficiency in new and existing public and private housing and provide incentives to implement energy efficiency retrofits in public buildings. I also recommend that you help homeowners shift from gas-powered appliances to electric, expand consumer choices for power consumption and production, and support the development and integration of new technologies, such as advanced insulation, windows, HVAC systems, and lighting. It's essential to make these measures affordable for low-income families by providing grants to utilities to make energy-efficient upgrades accessible to these communities, while also providing direct assistance to individual families and Indian tribes. The federal government can also reduce our impact on the climate and environment by providing grants to communities to build recycling and composting facilities and promote waste prevention. Composting reduces greenhouse gas emissions from landfills and incinerators, returns carbon to the ground, and reduces the need for chemical fertilizers. These investments can help us move toward a national goal of zero waste. As chair of the Native American Caucus, I'm working to address the federal neglect and underinvestment in Indian country. One of the most pressing needs is broadband service in tribal and rural areas, and of course that is a necessary addition for family farms across the country. The FCC reports that 92% of Americans have access to high-speed internet compared to 65% of Indian country, more comparable to developing country than the world's most prosperous nation. The federal government is creating new digital reservations for Native Americans, leaving Indian country to fall farther and farther behind. As you work on broadband policy, I urge the committee to pay particular attention to the needs and challenges in Indian country and rural America, which not only include education and health care, but also public safety, and which includes remedies to the crisis of missing and murdered Indigenous women. American Indian and Alaska Native communities also face a maternal mortality crisis. According to the U.S. Commission on Civil Rights Broken Promises report, Native American women are 4.5 times more likely than non-Hispanic white women to die while pregnant or within 42 days postpartum. To address this crisis, I joined Congresswomen Gwen Moore and Debbie Dingell to introduce the Mamas First Act. I urge the committee to support this bill that would allow Medicaid reimbursements for doulas and midwives to combat maternal mortality among the nearly 2 million on Medicaid giving birth each year. I thank you so much for the opportunity to address you this morning. Thank you, Chairman.
Thank you. And let me just say quickly, You know, last week when we did a full committee sort of marathon markup, we had this energy efficiency package that has provisions for grants to communities and a lot of the things that you mentioned. And that's part of this Lift America Act, which is sort of our infrastructure, our piece of an infrastructure bill, if we ever get to one, you know, with the president and with the Senate. And that has $40 billion for expansion of broadband in underserved areas. And part of that was in reaction to mine and others visiting some of the reservations. I remember we went to the Gila River in Arizona, and this is all they talked about, was how, you know, so many of the tribes don't have access to the internet. So a lot of the ideas that you're including, you know, we want to move on. So thanks again.
Thank you,
appreciate
Chairman.
it.
Thank you.
Thank you. And now we go to Congresswoman Shalala, who needs no introduction. I'm so proud of the things that we did when you were the secretary, and so progressive on so many of the things and working with this committee. Thanks for being here.
Thank you, Chairman Pallone. Thank you very much. I, as you can imagine, had 25 things I wanted to talk to you about, but I picked out 3. This week, we'll celebrate the 29th anniversary of the signing of the Americans with Disabilities Act, the ADA. So I've come today to talk to those who often don't have a voice. This crucial civil rights legislation prohibits discrimination against people with disabilities in all areas of public life, including at work, at school, and public accommodations. Last month was the 20th anniversary of the landmark Olmstead case. This case affirmed the rights of Americans with disabilities under the ADA to live independently and in their communities. Despite this recognition that the ADA prohibits the segregation of people with disabilities into institutions, integration has not yet been achieved. We have a lot more work to do. States have long wait lists for community services, and many people with disabilities are not able to receive them. Many people with disabilities live in fear that their fundamental right to live in their communities, the communities that they love, will be taken away from them, and they will be forced into an institution. This must change, and I am hopeful that this committee will consider in the coming months legislation to ensure that all people have the fundamental right to remain in their communities and in their homes. Earlier this year, Congressman Sensenbrenner introduced legislation called the Disability Integration Act, which would create a right to home and community-based services as an alternative to institutionalization. This bill is bipartisan, bicameral. I am the lead Democrat. It now has 234 co-sponsors in the House. I hope this committee will consider this critical legislation in this Congress. In a similar vein, it is my hope that the committee will consider H.R. 3215, the Disaster Relief Medicaid Act, which I introduced earlier this year with Congressman Langevin and Congresswoman Gonzala Colon and Holmes Norton. Natural disasters are occurring at increased rates across this country, and in the aftermath of such disasters, thousands of people are often forced to abandon their homes and relocate, often to a different state. After Hurricane Katrina, over 1 million evacuees relocated to another state. More recently, after Hurricane Maria, between 140,000 and 180,000 people left Puerto Rico. Many of them moved to Florida. The stress of moving after natural disasters is immense, but it's even greater for individuals and families that are eligible for Medicaid health care and long-term services and supports. These are the most severely disabled people that we know. The move from one's home state to a host state as a result of disaster can mean the loss of access to critical long-term services and supports. In this bill, we fill a very important niche. You'll remember that after these disasters, we often allocate money, but it often takes months or even years for the money to reimburse the states. In this act, the Disaster Relief Medicaid Act would ensure that individuals eligible for Medicaid who need these long-term services that are forced to relocate during a disaster, that they're able to continue their Medicaid-supported services. In other words, we would reimburse the states, the host states, at 100% for some period of time. So as Dr. Burgess will confirm, their services are seamless. So they can go to the host state and get those long-term care services without the state having to absorb the costs. Between wildfires, fires and floods and tornadoes and hurricanes, all of our constituents are threatened by natural disasters. No one should have to choose between evacuating and losing access to life-saving services and staying and possibly losing their life to a natural disaster. Finally, I want to implore this committee to consider the critical issue of youth tobacco and e-cigarette usage. Many of us in this room have been working on this for decades. We have achieved one of the great public health achievements of both the last and this century. We have driven down the number of kids that are smoking. And I joined you, Mr. Chairman, in introducing the Reversing the Youth Tobacco Epidemic Act of 2019. We've made extraordinary progress in this area. And the FDA and CDC have now reported an alarming 78% increase in e-cigarette use by high school students. Something has to be done to combat the youth use of e-cigarette products, and our legislation would raise the age to buy tobacco products to 21, which now has bipartisan and bicameral support. It would also create a universal ban on flavors on all tobacco products and prohibit the marketing of e-cigarette products to people under the age of 21. This will be our second big public health accomplishment, certainly of this century, and it's very important to do. And I hope you'll be able to mark up the bill in this session. Thank you very much.
Thank you. And again, as you know, I really value your expertise, not only because you were the secretary, but spent so much time over the years on so many of these health issues. With regard to the disabilities, it's really important that we do whatever we can to keep people in their homes in the community, not have them institutionalized. We'll continue to work on that. And all your work on tobacco, we appreciate. And I really appreciate, too, that you didn't just say, we need to raise the age to 21. I know the Senator McConnell has been, stressing that, but we need to address the vaping and, the flavored cigarettes and
Exactly.
these other
Clearly,
things
the
as well.
tobacco companies pivoted to target youth again. So now we need to do another piece of legislation to prevent that. And the American people are right there with us.
Thank you. Dr. Burgess?
Well, Mr. Chairman, as you know, we took a bipartisan field hearing to Puerto Rico. It's been almost 2 years ago. I think it's appropriate to consider a follow-on to the island. We basically were concerned about electricity grid problems at the time, but healthcare is obviously a big issue for the island, and we ought to include that in a field hearing in the near future.
Thank you.
Thank you, Dr. Burgess. And thank you, Secretary Shalala. Appreciate it. Now, I'm told that, we're trying to follow the order that we said when we asked people to come. So that's going to mean what? That we have Congresswoman Meng next, Mr. Congressman Sablon, and then we're going to go to Chairman Robel Allard, or the two together, I guess. So is that accurate? All right, we'll go to Congresswoman Meng. Thank you.
Chairman Pallone, Ranking Member Walden, Chairwoman Eshoo, and Ranking Member Burgess, and distinguished members of this committee, thank you for this opportunity to discuss several of my priorities as it pertains to the Subcommittee on Health, but also more broadly across the full House Committee. I sincerely ask this committee to move forward with the following bills and priorities. Protecting women and children from harmful chemicals is one of my top priorities. That is why I introduced a package of bills to ensure safeguards are in place to bolster consumer confidence that the products they purchase are safe for their loved ones. First, H.R. 2267, the Infant Formula Act, would prohibit the sale of expired baby formula. Although regulations require expiration dates to be placed on formula, federal law does not prohibit the sale of infant formula after its expiration has passed. I was shocked to learn that parents who unknowingly bought these expired formula reported their infants being violently sick. Busy parents need to be able to rely on the safety of products like formula that they buy in grocery stores to make sure their newborns are well-fed and healthy. Second, H.R. 2268, the Menstrual Products Right to Know, would require companies to list ingredients in feminine hygiene products such as scented and unscented pads, cups, scented and unscented tampons, and therapeutic douche apparatuses. We can easily see the ingredients used in the shampoo we put in our hair or in the foods that we eat. The same transparency requirements must apply to products that touch or are inserted to our most sensitive and absorbent parts of the body. Third, H.R. 2269, the Get Additives Out Act, would require a GAO report on the physical and behavioral health risks of food additives on children. The food additives and its effects are dramatically understudied, particularly on the impact on children as they enter critical stages of development. I'm committed to ensuring more transparency in the foods that we eat and the foods that my boys eat. In the coming months, I will also be introducing legislation to address the Consumer Product Safety Commission's inability to effectively oversee recalls, particularly with products that threaten the safety of infants and children. The Britax jogging stroller recall rollout was a shameful fiasco with failed missteps and a clear abuse of consumers' trust. Sadly, this incident is not the exception, which is why I will tackle this issue head-on. As the co-chair of the Congressional Hepatitis Caucus, I also recently introduced HRES 505, which recognized July 28th as World Hepatitis Day. This legislation also encourages people from across the world to take preventative action and urges greater partnerships between federal, state, and local health departments to eliminate new infections in the U.S. Another one of my priorities is to ensure access to affordable menstrual hygiene products. One might think these products are ubiquitous and cheap, but many women face difficulty when it comes to affording and accessing them. I know this because I've heard heartbreaking testimonies from girls and women across our nation. That's why I introduced H.R. 1882, the Menstrual Equity for All Act, which is a comprehensive solution to ensuring this basic health care need for over 51% of the U.S. population. No girl should have to choose between their dignity or their education. No one should have to lose their dignity just because they are incarcerated. And no family should have to choose between buying these products or groceries. Additionally, I'm deeply committed to the issue of our environment and its impact on the health of our constituents and their families. That's why yesterday I introduced the Safe Drinking Water in Playgrounds and Parks Act, which would ensure that states, schools, and municipalities have the necessary resources to replace drinking water fountains in those places. As you know, no amount of lead is safe for consumption, and if consumed, its effects are dangerous to children. Furthermore, aviation noise is a critical issue that impacts my district in Queens. That is why, as the founding member and former co-chair of the Quiet Skies Caucus, I introduced H.R. 3001, the Quiet Communities Act. This bill would reestablish the Office of Noise Abatement and Control in the U.S. Environmental Protection Act. Chronic exposure to excessive noise can have short and long-term negative health impacts, including hearing loss, stress, high blood pressure, and diminished cognitive performance. Noise pollution is not just a minor inconvenience, it's a health issue that needs to be addressed. Thank you again to the subcommittee and the committee for allowing me to testify. I ardently hope that we can work together on the priorities I have set forth today.
Thank you, and we'll certainly follow up on those bills. And I'm not surprised there's so much emphasis on kids when I see you, taking those two boys around all the time. So thanks again. Did you, Mr. Griffith? Go ahead.
Mr. Chairman, I do think we should probably take a look at the food additives and the impact they have on folks. I have a number of food additives that I avoid, so it's not just children, but children may not know what's going on. Usually I can, through elimination, figure out what's causing a reaction, but it's something we should probably take a look at.
Absolutely. All right. What's that? Thanks again, unless you wanted to say something else.
I do.
Oh, I'm sorry.
That's all
The
right.
chairwoman of our health subcommittee, Ms.
Thank
Eshu.
you. I want to thank our colleagues that are at the witness table. I have to say it's refreshing to have other members that are not on the committee come in and be with us. You have important ideas, and in terms of the jurisdiction of my subcommittee, I'm going to take your bills seriously. So this is not a waste of your time here. Grace, thank you for your work on Quiet Skies. My congressional district is practically turned inside out, upside down by that new FAA program, Next Gen. And I don't know if other members realize this, but the FAA bears no responsibility today for noise. No responsibility. And other health impacts. So I want to work with you on that. So thank you to each one of you. It's wonderful to see you. You're wonderful legislators. You're great friends, and you're always welcome here.
Thank you. And as Chairwoman Eshu said, you know, this Members' Day is not just you come here and that's the end of it. Do not hesitate to contact us or have your staff contact our staff to follow up on these things that you mentioned, please. Thank you. Mr. Saban, good to see you.
Yeah, good morning.
Good morning.
Good morning, Mr. Chairman.
Or I guess it's the afternoon, actually, but go ahead.
Oh, okay. Well, I'd like to thank Chairs Pallone and Eshu and to Ranking Members Walden and Burgess for the opportunity to provide testimony to the Health Subcommittee today and to the full committee, actually. And thanks to all the members for reporting favorably the REACH Act last week. This health extenders package is good news for the Marianas and all the insular areas. It reauthorizes critically important community health centers, of which the Marianas has one. Most importantly, it includes the Territory's Health Care Improvement Act and addressing the Medicaid cliff the insular areas face when special Obamacare funding ends this year. Thanks also to Mr. Soto and Mr. Bilirakis of the committee for understanding the urgency of this insular Medicaid crisis. They put together the Territory's Health Care Improvement Act with myself and 7 other original bipartisan co-sponsors to give Puerto Rico the help it needs. And the bill also becomes the means to help the 4 insular areas. It provides just what the Marianas Medicaid director told this committee she needed, $60 million per year. No local match required for the first 2 years, of which will allow the Marianas government to direct more money to help recover from last year's typhoons. And after 6 years, we will get the best FMAP that any state is currently offered. This legislation will make the insular Medicaid programs more state-like in other important ways. New program integrity requirements, which I support, assure that every federal dollar is used as intended. Having a better record of utilization, enrollment, and expenditures will allow for a greater understanding of the unique healthcare challenges the insular areas face, and I hope provide a basis for the policy that comes after. Because as grateful as we are that the Medicaid cliff is being addressed, and in a way that matches need, we know 3 things from experiences with the ACA's Medicaid fix. Time will pass quickly. The ACA fix lasted 8 years. Then we had the present crisis. The current legislation will last for 6 years. Perhaps with the better understanding we expect to gain over that time, we will be able to fix the problem once and for all and treat Americans living in the insular areas like all other Americans when it comes to Medicaid. The second lesson, humility. We may think that the funding we are providing to each insular area meets their needs and their capacity to use the money. But we learn over the course of the ACA that our predictions are not always accurate. Some of the insular areas used their ACA money, some did not. Some ran out of funding because their needs were greater than Congress foresaw, and Congress had to intervene with stopgap measures. Some areas are leaving money unspent after 8 years. We should learn from that experience. Emergencies arise that cannot be predicted. The recently enacted disaster supplemental included my amendment to provide an additional $36 million in Medicaid funds for the Marianas because with last year's typhoons, our program was down to its last dollar. In the 7 weeks since enactment, 60% of those funds are already expended, and the balance is scheduled for expenditure by September 30. Emergencies arise, so I would humbly suggest that some mechanism be built into the REACH Act to make sure its funds can be reallocated if necessary. I know our staffs have discussed this problem, but without resolution, and I would suggest that all of us ask our staffs to work a little harder so we do not repeat that mistake of the Affordable Care Act. I thank the Health Subcommittee for favorably reporting the Territories Health Care Improvement Act, and I thank the full committee for bundling it into the REACH Act. You have made a great step forward to ensure that healthcare in the insular areas can be as good as healthcare anywhere in America. And finally, and always, gratitude. I am ever so grateful to the American people for the assistance they provide to my constituents in the Northern Mariana Islands. Medicaid provides a means to keep our only hospital open and to allow specialized services to patients who need to travel off-island for these services. I say this with all sincerity. I'm always truly grateful for America's help for so many of the needs of Americans in the insular areas, especially the Northern Mariana Islands. So for the many Americans in the Northern Marianas, I'm from a grateful non-voting delegate, Mr. Chairman, and all the members of the committee. Thank you. Thank you very much.
Thank you, Mr. Saban. And, I really appreciate your input and that of the representatives from the other territories, not only on the Medicaid issue, which, as you mentioned, from Ms. Eshu's subcommittee, we addressed that pretty long-term, considering where we've been before with these stopgap measures. And we're hoping that, in the fall that we can take this issue up very quickly. But I know we have to address so many of these concerns in the territories and make sure that whether it's health care or energy or whatever else, that it's equal to, continental U.S. or whatever. And you have been very helpful in pointing things out and, giving us ideas about what we need to do. So I want to thank you for that in particular. Thanks for being here. Now we're going to go to, I understand that we have two congresswomen who kind of wanted to testify together here on, I think it was on maternal health issues, but I'm not surprised because I several times saw Ms. Butler on the, with her, what was the name? Isana, was that it?
Isana.
Isana, which you're carrying her around, and I asked you what it meant, and you said strong-willed or something like that.
Strong-willed woman.
All right. Well, do you want to start, or Lucille? Lucille will start? Okay, the chairwoman of the Appropriations Homeland Security Subcommittee. And thanks I'm glad we were able to work things out last night. I know we were here late, but we finally got the bill done, so that was good.
Screening.
Yes.
Yeah, thank you. Mr. Chairman, thank you for this opportunity to submit our testimony in support of Maternity Caucus priorities in Congress.
We co-founded the Bipartisan Congressional Caucus on Maternity Care to raise awareness about the status of childbirth in this country and the challenges facing America's maternity care system. It often takes a visible catalyst to get the attention of policymakers, and for maternity care, that catalyst has been the worsening maternal mortality crisis, which this committee, I know, has delved into. The CDC estimates 700 women die every year because of pregnancy or delivery complications, and tragically, 60% of those losses are preventable.
We must do everything that we can to ensure the safety of women. It is also critical to recognize that maternal mortality is just the tip of the iceberg. More than 50,000 women experience severe complications of pregnancy that adversely impact their health. Our infant mortality rates are higher than 33 other similar wealth countries, and we have made some of the slowest progress in the world in reducing stillbirth rates. Adding to these concerns is the extraordinary cost of U.S. maternity care, estimated at over $50 billion. With Medicaid financing 43% of all births, the federal government must ensure cost-effective maternal newborn care.
Our communities also face growing shortages of maternity care providers. The March of Dimes estimates that more than 5 million women in the U.S. Live in a maternity care desert, including areas in our districts, Southwest Washington or Greater Los Angeles. We believe it's time to make these issues a national priority. We encourage this committee to schedule more hearings to address the maternal and infant health issues and explore solutions to advance safe and cost-effective maternity care for mothers and babies.
We have several policy recommendations for your consideration. 1, midwives are a critical part of the solution to addressing these problems in our maternity care system. But compared to many other countries, they are vastly underused as providers. Increasing access to midwives will help address maternity care shortages while lowering costs and providing high-quality care. Last week, as co-chairs of the Maternity Care Caucus, we introduced H.R. 3849, the Midwives for Moms Act, to expand midwifery education and address the lack of provider diversity by prioritizing students from minority and disadvantaged communities. We hope that you will consider this legislation.
The bipartisan Preventing Maternal Deaths Act was signed into law in December and was the first legislation of this kind. This will improve data collection on number 2. I switched. You probably figured that out. It's the first of its kind, and it's going to improve that data collection on maternal mortality so we can begin understanding why mothers are dying. This was a critical first step, but this is just a first step. More work needs to be done. And we believe there are bipartisan opportunities to ensure that vulnerable populations of women have access to care during pregnancy and the postpartum period. We would also like to work with you on implementing best practices through initiatives like the Alliance for Innovation on Maternal Health.
Number 3, despite World Health Organization recommendations to eliminate unnecessary childbirth interventions, the U.S. continues to have some of the highest cesarean birth and induction rates, and yet continues to underuse proven models of care, such as group model prenatal care and birth centers. After the August recess, we will be introducing the Moms and Babes Act to prioritize evidence-based care across all federal maternity care programs and promote research about physiological birth and best practices to achieve optimal birth outcomes. We would like to work with you on this effort.
As members of the House Appropriations Subcommittee on Labor, Health, and Human Services and Education, we have worked in a bipartisan fashion to support critical programs and initiatives to improve the lives of both mom and baby, including robust funding for the Maternal Mortality Review Committees, the Maternal and Child Health Block Grant, Healthy Starts, and many others. We look forward to working collaboratively with this committee to build on this work.
Mr. Chairman, Chairwoman Eshoo and Ranking Member Burgess, we thank you for your leadership, and we look forward to partnering with you to advance solutions to improve maternity care outcomes for all our nation's mothers and their children. Together, we can make maternal and infant health a national priority. We believe this is long overdue. Thank you.
Thank you.
Well, thank you both for being here and being here on a bipartisan basis. And you both are appropriators, so obviously we can work with you on a lot of these things, and we certainly will take them up. I do think it's a disgrace when we talk about maternal mortality and how we compare with other countries. And just one thing, I know I'm supposed to move on here, but when you mention C-sections, and it's a while ago now, but I remember with my wife, we have 3 kids, and the first 2 were C-section, right? But she always wanted to not do the C-section if she could. And so when the 3rd one came along, she said, well, if it's at all possible, I'd rather not have a C-section. And all the doctors come, oh, you already had 2, it's not a good idea you should have a C-section again, let's just schedule in advance. And she absolutely refused. And our daughter was born without the C-section, sort of proved them wrong. But that's always been the case, and it's still the case that they always try to push a C-section when it's not necessary sometimes. So I appreciate you bringing that up, but there's so many of these issues that you raise that are so important. with Chairwoman.
Thank you,
Eshoo and then
Mr.
Dr.
Chairman. I want to thank both of you for being here today and all of the work that you're doing with your caucus, the legislation that that you highlighted today, and I love the way you double-teamed it. At the Health Subcommittee, I've been trying to find out from CRS if the Health Committee has ever had a hearing on the state of women's health in the United States of America, and we can't find one. And I think it's about time that we do one. You know that as when we are part of a congressional delegation to a foreign country, on one of the first pages of the handbook from the State Department is how that country is measured. One of the yardsticks is infant mortality and maternal mortality. And now our numbers keep going up. So your work is critically essential. And I look forward to post-August where we actually do something that will represent and hopefully touch the lives of the largest percentage of our country, and that is women. So bravo to you. Bravo to you for your beautiful work. Thank you.
Thank you. Dr. Burgess?
Well, I don't know if people recognize what an extraordinary accomplishment it was for Jamie Herrer Butler to get that standalone maternal mortality bill through and signed in the last Congress. It really was a milestone. There were days I didn't think it was actually going to happen. Certainly, the representative put a lot of effort into it. Our subcommittee staffs on both sides of the dais did get it across the finish line. Another milestone that we were able to accomplish in the last Congress was on the health professions shortage areas, including maternal care providers, without actually changing the appropriation, we changed the authorizations that we could include maternity care providers in health profession shortage areas. So we can build on those accomplishments. I know the past is prelude, and we can continue to do that. I've got some ideas, and we'll continue to work on those things. So I appreciate you both being here. It is an important topic and one that we need to maintain our focus. Thank you.
Thank you, and thank you both, really, for what you're doing. We appreciate it. Continue to work with us. And now we'll go to my friend, Congresswoman Napolitano. Thanks for being here.
Thank you for having me, Mr. Chairman, and thank the ranking member. My bill is H.R. 1109, which I feel we must pass. Pardon me. The Mental Health Services for Students Act. This is my 6th Congress, and I'm hoping this time we'll be able to get it off the ground. I have a Senate co-sponsor, Tina Smith of Minnesota, has a companion bill of Senate Bill 1122. 16 members of the House Energy and Commerce Committee, this committee, support my bill. Cardenas, Barragan, Tanco, Clark, Rush, Matsui, Castor, McNerney, Welch, Lujan, Kennedy, Dingell, Vasey, Custer, Kelly, and Soto, and we hope to add more. My bill will provide $200 million per year for 5 years for 100 school-based pilot programs on mental health nationwide. It expands the scope of the Project Advancing Wellness and Resiliency Education, called AWARE, the program, by providing on-site licensed mental health professionals in schools in the community. The funding for the program would do the following: provide for comprehensive staff development for school personnel and personnel working in the schools, includes administrators, the teachers, assistants to recognize mental health issues. It would support and implement comprehensive, culturally and linguistically appropriate services. It would deliver assistance to local communities in development policies to address their own child and adolescent childhood trauma and mental health issues and violence when and if it occurs. Establish mechanisms for children and adolescents to report incidences of violence or plans by other children, adolescents, or adults to commit violence. It would also promote positive mental health education and support for parents and siblings and other family members of children with mental health disorders, as well as concerned members of the community. H.R. 1109 is supported by the Mental Health Liaison Group, which consists of 51 mental health organizations. It's supported by Los Angeles County Board of Supervisors, also by the National Education Association, the American Federation of Teachers, and others. The bill is modeled off a school-based mental health program developed in 2001. The Pacific Clinics and I started in with $500,000 for SAMHSA with seed money, which ended in 2009. SAMHSA no longer funds it. It's taken over by the County of Los Angeles. And been instrumental and have grown the project to 35 schools instead of 4. The program began in 3 middle schools and 1 high school. And as I said, it's already grown, and we're hoping to add more schools pretty soon. But I thank you very much for the opportunity, and I hope that you will consider this in the future. Thank you.
We certainly will consider it, and we know that a lot more needs to be done with regard to mental health issues. So thanks again. Appreciate it. Next is a gentlewoman from Georgia, Ms. McBath.
Thank you very much, Mr. Chairman and the esteemed committee. Thank you so much for allowing me to discuss a very important topic to me. Once again, as we've heard a little bit earlier today, maternal mortality. I'd like to thank my colleague and member of this committee, Representative Robin Kelly, for being a champion on this issue. The importance of her legislation, the Mothers and Offspring Mortality and Morbidity Awareness Act, or MAMAS Act, cannot be overstated, and that is House Bill H.R. 1897. The United States has an atrocious record when it comes to maternal mortality. As many on this committee already know, our rates of maternal mortality are the highest among other developed nations in the world. What's more concerning is that there's been a significant increase in the maternal death rate from 1991 to 2004. The rate has more than doubled. This is absolutely unacceptable. We need a comprehensive solution to this crisis. Progress on this important issue has stalled and represents an incredible failure. It is a failure to women throughout this country, especially women of color, who experience maternal mortality at rates 3 times that of their white counterparts. We have a responsibility to mothers and to their families to make sure that safety and health is our #1 priority. The research is absolutely clear. Comprehensive care for pregnant women saves lives. According to the Centers for Disease Control and Prevention, 60% of maternal deaths are completely preventable. Extending coverage for a full year will simply save the lives of many of those mothers. And while maternal mortality is certainly the worst outcome, it's not the only outcome. Many women suffer from complex illnesses that complicate their pregnancy and endanger their health. I shared the story of a constituent of mine recently on the House floor. Her name is Pfeiffer. She struggles with a mental health disorder. During her pregnancy in 2014, she had to have an immediate surgical correction for an irregularity in her cervix. The surgery failed, and at 20 weeks, she was confined to bed rest for the duration of her pregnancy. Her mental health was not addressed. At 30 weeks, she gave birth to a beautiful baby boy, but then her mental health was yet again not addressed. Almost immediately, she began to suffer from postpartum anxiety. She abandoned many things that once gave her joy, and it took her 12 months for her diagnosis to actually come to fruition. This story is just like millions of other mothers throughout our country. We must do more to improve the range of services available to these young mothers. We must do more to care for the coordination for these young mothers. We must do everything that we can to give these young mothers the best possible care they deserve. And so we're faced with a challenge. Make no mistake, that maternal health in this country is in crisis. The Mama Act will help save the lives of mothers across the country. The Congress has this opportunity to act in the interest of these mothers and their families. And as you know, the Mama Act would provide access to life-saving health care for a year after conception for women who use Medicaid. It would allow for Medicaid coverage of doulas and midwives, expanding access for people who lack access to an OB/GYN doctor. Not only does this legislation extend coverage for low-income women, but it improves maternal health for all women by increasing care coordination by health systems and ensuring that every mother has access to the best possible care. This legislation would help America keep the promise of safety and happiness to these new mothers and their infants. Thank you for the opportunity to testify. Thank you so much for hearing my heart.
Woman, I agree when you said maternal health is in crisis, and we need to address it, as you heard the testimony of your colleagues. So we will follow through. Thanks so much. Okay. My colleague from New Jersey is next.
Thank you very much, Mr. Chairman, and to the ranking member, and to the members who are here today. Thank you very much for holding this Members' Day hearing. I want to begin by stressing that the Affordable Care Act has been a literal lifeline for many in my district, New Jersey's 12th Congressional District, as well as in communities of colors across the nation. Since 2010, the rates of uninsured African Americans have nearly been cut in half, going down from 20% to 11%. In my district, if the ACA were to be struck down by the courts in Texas versus Azar, nearly 50,000 people would lose their health care insurance. So while the law isn't perfect, I know you, Mr. Chairman, and your committee are committed to protecting the ACA and expanding access to health care for all Americans. And in the spirit of that, I come before you today to ask for your commitment to addressing the inequities that our healthcare institutions and structures create, which put women and patients of color at elevated risk for certain morbidities and even mortality. For Black mothers who are often provided lower quality maternal care when they can access care at all, the ACA's requirement to cover pregnancy, labor, delivery, and newborn care as essential benefits in health plans was absolutely critical. However, since nearly half of pregnancies are unplanned, many women don't have a plan when they find that they are pregnant. Or if they have a short-term plan, it doesn't cover pregnancy care. Surprisingly, while our system currently considers getting married or giving birth to a child a qualifying life event, allowing one to sign up for health insurance, pregnancy does not currently trigger one of these special enrollment periods. This is particularly alarming when Black maternal mortality rates in the United States are similar to rates in developing countries at 40 deaths per 100,000. This is why, as a founding member of the Congressional Caucus on Black Women and Girls, I made it a priority to address the gaps in our healthcare system, which result in Black mothers dying at 2 to 6 times the rate of their white peers. In addition to organizing stakeholder convenings to talk about this disparity, we are pushing legislation that is important to addressing health disparities among Black women and girls. One of the first bills that I introduced when I was elected to Congress was the Healthy Maternal and Obstetric Medicine Act, or commonly referred to as Healthy Mom Act. The Healthy Mom Act would create a special enrollment period in the insurance market for women when they become pregnant so that they and their child are able to receive the health care that they need. This Congress, the Healthy Mom Act, is H.R. 2278 and currently has more than 75 co-sponsors. Chairman Pallone, as you and your committee explore ways to protect and expand access to health care for American families, I implore you to also work to address racial and ethnic disparities in our system. The Healthy Mom Act has the potential to be a part of that solution. Before I yield back, I would be remiss to not mention that this year is the 20th anniversary of the REACH program, which stands for Racial and Ethnic Approaches to Community Health. REACH remains one of the CDC's only programs specifically dedicated to addressing racial and ethnic health disparities. Started during the Clinton administration, REACH is unique because it follows a community-led model which includes robust engagement of the population impacted by health disparities and multi-sector representation in all aspects of program planning, development, and implementation to successfully tailor programming for communities of color with the greatest chronic disease burdens. As this subcommittee looks to address racial and ethnic disparities, I do hope you will look to REACH grantees for lessons learned in how to address racial health disparities and to incorporate them into your own policy proposals. And with that, I yield back, and I want to thank you for this opportunity to address these issues today.
Well, let me thank you. I know you have a long history of working on a lot of these healthcare issues, both here and in the state legislature. And you know, we'll certainly follow up on the Health of Moms Act. And you know, the CBC for years has had this, healthcare disparities issue that they highlight. I guess they have their brain trust, is that what it's called? Robin Kelly, for a long time, I don't know if she still is, but was the head of that. She's on our committee now. So, you know, we have incorporated some of those things, but I know a lot more needs to be done, so we'll work with you. Thank you, Bonnie.
Chairman.
Thank you. Oh, and the Chairwoman Eshu wants
I
to
just
make...
wanted to say, Bonnie, thank you for the courage that you've exhibited to all of us. And
Thank you, Madam Chairman. Thank you.
And I think our prayers are answered, and now we've got to get your legislation done. Okay?
Thank you.
Thank you.
Thank you, Chairwoman Eshu. Thanks, Bonnie. Next, we have Mr. Levin of Michigan. Thanks for being here.
Thanks so much, Chairman Pallone. I'm learning while I'm here. Of our 4 kids, the first 3 were all delivered by midwives, so I've got to get on board with the Mama Act if I'm not already. So, but I want to thank you and Ranking Member Walden, Chairwoman Eshu, Ranking Member Burgess, members of the subcommittee for allowing me to testify today. And I'm here today to talk about drug pricing, a topic that I know has been a tremendous priority for this subcommittee and for our constituents. I want to applaud the hard work that Energy and Commerce has already done this year to tackle this issue. But as you know, and all of us know, we have more work to do. Personally, my family knows this all too well because 2 of my sons live with Crohn's disease. And actually in the anteroom, I got a call from someone trying to get to one of my sons to give him an infusion. It's that he needs, to be healthy and survive. My wife, Mary, and I would do anything to keep our kids healthy. And I know parents across this country feel the exact same way, even if it means waiting to pay another bill or neglecting necessities for themselves. Families in every community are making incredibly hard choices for the sake of their kids. They shouldn't have to. I came to Congress to raise the standard of living for working people in Michigan's 9th District and across our country, and to ensure that the deck isn't stacked against American families. That's why I've introduced the Stop the Overuse of Petitions and Get Affordable Medicines to Enter Soon, or the Stop Games Act. This common sense bipartisan bill that I authored with Congressman Francis Rooney of Florida will help to stop pharmaceutical companies from gaming the system to block competition. There have been multiple reports of drug makers attempting to use the Food and Drug Administration's citizen petition tool to keep generic competition from coming to market. While the citizen petition is meant to ensure that stakeholders can flag legitimate issues with drugs awaiting FDA approval, reports indicate that drug makers have filed baseless petitions to protect their monopolies. In fact, in October, then FDA Commissioner Scott Gottlieb listed the misuse of citizen petitions among anti-competitive techniques of concern. Even if FDA doesn't ultimately agree with the petition's argument, the agency must investigate and respond to what are sometimes unsubstantiated claims. This prevents more affordable drugs from reaching consumers quickly, forcing American families to pay more. For example, in 2017, the Federal Trade Commission filed a complaint arguing that ViroPharma's use of the citizen petition process constituted an antitrust violation. According to the FTC, ViroPharma's repetitive, serial, and meritless filings lacked any supporting clinical data and succeeded in delaying generic entry at a cost of hundreds of millions of dollars. The Stop Games Act would, as the title suggests, stop these kinds of games. Our bill outlines circumstances under which the FDA can promptly reject a petition meant to delay the approval of a generic competitor and directs the Secretary of Health and Human Services to report any such incidents to the FTC. The bill also requires drug makers to file a petition within 60 days of learning the information it's based on, not right before a patent or exclusivity period expires and rival drugs are ready to come to market. Finally, the bill requires enhanced reporting to keep Congress informed of efforts to game the FDA approval process. As your subcommittee continues its important work to bring down drug prices, I urge you to consider the Stop Games Act and ensure the FDA citizen petition tool cannot be misused to keep prices high. I thank the members of this committee who've already co-sponsored the bill, Congressman Tonko and Congresswoman Schakowsky, and I would welcome the chance to talk with more of you about this important fix. Again, I want to thank you all for the privilege of testifying before your subcommittee and truly look forward to working with you on this bill and others on behalf of working families.
Well, let me thank the gentleman, and you certainly raise issues that we care a lot about, with in terms of trying to reduce drug prices. This is bipartisan, includes the president as well. We did the generic competition bills, passed the House. We did transparency bills last week. They're going to come to the floor probably in September. And I know that, the citizen petitions, has been abused, so we'll certainly follow up.
Thank you so much. I really appreciate your help. Thank you, and I yield back.
Thanks. I'm going to ask Mr. Schweiker to replace Mr. Levin because he's come back and forth several times and we've passed him over. So why don't you go next, because we passed you over several times, and then we'll go to another three. Thanks.
Thank you, Mr. Chairman, Mr. Griffin. So this is where all the cool kids hang out, right?
Yeah, right.
And I appreciate doing this, and having sat up there through the Ways and Means member hour, I know sometimes it's interesting seeing the inbound of different concepts and thoughts coming from fellow members. I have two. One I just want to share with you. It's a little conceptual, though we're working on the legislation, and the other, it's a bill that's sat in E&C for a couple of years now. One, I want to argue, just conceptually, this is for every Republican and Democrat, we're having the wrong argument about health care. Over and over and over. So if you and I were to strip away some of the noise, the ACA, who got subsidized, who had to pay? Our Republican alternative, who got subsidized, who got to pay? I want to argue we're living in a world right now that if we could legalize technology, there are wearables coming, something coming very soon where you can blow into it and it would diagnose whether you have a viral infection or a bacterial infection. The algorithm can write a prescription. There's technology coming, and it's on the cusp right now. If we can remove the barriers to it, that can crash the price of healthcare. Wouldn't it be a much more, if we really care about our comments about we need to reduce the price of this, price of that, it's time for that sort of blockbuster video moment where one day you stop going and picking up this little silver disc because you're hitting a button at home. That technology exists, and yes, it is going to be disruptive. We're going to have hallways full of incumbents who are saying, you're putting us out of business. Why are you letting an algorithm write a prescription? Why are you allowing data to actually be, but we know that data is actually the holy grail in healthcare. So please, we're working on it. We're actually working on it with a couple members of your committee, both Republican and Democrat, who sort of see the vision that we're at that inflection point where we can use technology to crash the price of healthcare. And as a simple request also, I had a Congressman Andy Biggs grab me sitting here, and he just asked me to put his testimony and a letter into the record if...
Without objection, so ordered.
So I will put that, hand that to staff. So here's the piece of legislation we've had in the committee now for a couple years. Let me also make sure I have the right number for this year. It's H.R. 1284. Think about how many members will come in front of you today and actually express real concern about the environment. Are we tracking what's happening out there? Do we know what's happening? Back to that same sort of techno-utopian that's rolling out right now, there's now sensors you can wear on yourself that talk to your supercomputer we call your smartphone. How about the concept of crowdsourcing environmental data? And why this is so important, it's not Republican or Democrat, it's just data. But the elegance of it, if you have some clowns painting cars in the backyard behind your house, how do you catch them? In today's environmental regulatory system, it's a paperwork system. So we have our fixed towers that cost about $1 million a year to maintain, and then we have manufacturers, companies, those fill out lots and lots and lots and lots of paperwork. Does paperwork shoved into file cabinets make our environment cleaner? I want to argue, how about a system it's less about the paperwork and actually more about keeping the air cleaner? And now that there's this revolution of these new sensors that we could have a few thousand in a community that tell you, hey, we have a bad act happening over here. Hey, a business over here may be having a problem with its scrubbers. Instead of spending 2 years putting paperwork in a file cabinet so one day you can sue them, how about knocking on the door and saying, hey, we have a hot spot here, let's fix it. Now, it's a revolutionary concept because you have to understand the current environmental regulatory model in many ways is lots of people sitting in office chairs processing paperwork. How about the concept, just like you may use Waze when you're driving through a crowded area, it's the collection of the data that gets you there faster. Why wouldn't we do that same technology, that citizen science technology, to say maybe file cabinets full of paperwork isn't the best way to protect our environment, but living data of, is there something, a difficulty here? For those of us that live in the desert Southwest, we actually have real concerns because we don't know some of our baseline number. What's baseline ozone? How much stuff comes in from the LA basin and blows in? And if you have enough data points, that the crowdsourcing, it's much more elegant in being able to protect the environment. And I would argue, whether it be air or in Flint, Michigan, the simple little thing they could have put under a faucet that's under $100 that would have told you there's a problem. It's time we embrace the fact there's a technology disruption that can fix so many of these goals. And yes, it's a threat to the bureaucracy, but the benefit is we live in a cleaner world. With that, I yield back, Mr. Chairman.
Well, thank you. I'm sorry you had to keep coming back, but I love all these innovative ideas and use of technology, because that's kind of what we pride ourselves on this committee. So,
well, Mr. Chairman, you have the legislation. If your environment subcommittee would ever, and I have Republican and Democrat sponsors, I know you've been incredibly busy, but it has sat here now for a couple of years.
Yeah, we'll take a look at it. And thank you for coming. Appreciate it. What's our order next here? Okay, Congressman Trone, you're next. Thank you.
Thank you, Mr. Chairman, and members of the committee for this opportunity to testify. As many of you know, addressing the addiction crisis in America is my #1 priority in Congress. My constituents sent me here in large part because we firmly agree that more must be done to stop the 192 drug overdose deaths happening every day, 2/3 of which involve opioids. Every death from addiction connects another family and community to the crisis. My own connection is devastating, but will sound all too familiar. On New Year's Eve in 2016, my nephew, Ian Trone, died from a fentanyl overdose. He was 24. He died alone in a hotel room. One of my first actions as a representative was creating the freshman working group on addiction. I know our historic freshman class could make real progress if we work together across party, geographic, demographic lines. It's bipartisan, with 64 members from 31 states across the country. Despite our diverse backgrounds and viewpoints, we're united in our understanding of the necessity to put aside our differences and come together to save lives. Members of our working group, 64 strong, have introduced legislation to ease access to naloxone, to put sanctions on producers of illegal fentanyl, increasing training for prescribers and law enforcement, and to require better warning labels, beef up research on addiction, and coordinate and track federal demand reduction activities. I was proud to work with fellow freshmen Representatives Denver Riggleman, Kelly Armstrong, Mikey Sherrill, to introduce H.R. 2466, the State Opioid Response Grant and Authorization Act. This bill would authorize $1 billion in funding for state opioid response grants and tribal opioid response grants for each of the next 5 years to fight the opioid epidemic in every community across the country. Each state receives at least $4 million through the program, with additional funding to the 10 states with the highest mortality rates due to drug overdoses. The bill came from conversations with real people in our districts. In the early days of our roles, we toured our districts. We spoke with health departments, hospitals, first responders, elected officials, police officers, incarcerated individuals, mental health professionals, early childhood organizations, and of course, those suffering from addiction. We heard loud and clear, we need additional, and most importantly, consistent funding to end this crisis. Funding that allows local communities to provide individualized and specific services to their community. This legislation does just that. It gives certainty, the certainty that states need, that will provide them the funding so they can expect that to continue for at least the next 5 years. There's no committee better positioned to make real and impactful progress on this issue than Energy and Commerce Committee. You hold the power to advance legislation to authorize additional funding for prevention and treatment programs, require more robust training for our medical professionals, ease restrictions on prescribing life-saving medication-assisted treatment, and so much more. I urge you to use the power of that to take further meaningful steps to combat the addiction crisis, including passing a large package of legislation that will dramatically increase our response to the worst public health crisis our country's ever seen. I recognize the committee has taken bold action in the past by passing the Comprehensive Addiction and Recovery Act, CARA, the 21st Century Cures Act, and the Support for Patients and Communities Acts. I commend you for that and thank you. But the last 2 years, we've lost 141,000 people from our country. 141,000 people in the last 2 years. This is a call to action. It's important what we've done, but we need to continue to take bold action to save lives. Thank you for the chance to share our thoughts with you today and for your engagement in this important work, and we'd like to partner with you in these efforts.
Well, I want to thank the gentleman. I mean, you're right on point in terms of raising the issue of fentanyl. We mentioned with your nephew, unfortunately. We just had a hearing on that. And we know that we have to do more in terms of funding. The biggest concern I have is that, that $6 billion that we appropriated on a bipartisan basis over 2 years, $3 billion a year, that expires in February. So if we want to continue with the state grants, we have to, come up with a way of funding that. And, there's a lot of concern also. Congressman Cummings came to visit me earlier this week about getting that money down, getting money or grants down to the county and the local level as well. So we're going to definitely follow up, and I appreciate your bringing this to our attention. And go ahead, Mr. Griffith.
Thank you, Mr. Chairman. I do appreciate your comments. The Washington Post has been doing a whole series of articles on opioids, and my district has been particularly hard hit, and that's one of the reasons I would agree with Mr. Cummins. We need to get down to the local level as well, because while the state of Virginia has issues, I don't know whether it's in the top 10, but the Washington Post article pointed out that the most number of pills, number 1 was in my district, number 2 was in my district. 2 communities that were 1 and 2 on the rank of pills that were sent out from 06 to 012. We've had a number of deaths. A book has been written, Dope Sick, by Beth Macy, about the problem in the Appalachian region of Virginia and the Shenandoah Valley. The other parts of the state may not have as many deaths per capita as we have, and so we may need to look at some of the programs where we can go into the hot spots and deal with those, as opposed to look, because some of the states like Texas are huge, Texas, California, they're huge. Some of the smaller states may have hot spots that need help, but they may not register because they're not as large as some of the others. But we also, in talking about treatment, the deepest part of my district in coal country, there are no treatment facilities, no overnight treatment facilities. You can get some day stuff, but that's about it. So we need to work on that. And I think we need, Mr. Chairman, to push the FDA to come up with non-opioid-based pain relievers and to push those as hard as we can, non-addictive pain relievers. But I will say this has been a bipartisan effort by this committee. And Mr. Chairman, I know that will continue, and we're going to all work together to try to see what we can do. And I am so sorry that it hits every family, but not a death hits every family. And I'm so sorry for your family that a death resulted from an addiction.
Thank you. Chairwoman Eshoo.
Thank you, Mr. Chairman. Mr. Trone, thank you for coming and testifying today and for your passion for running and coming to Congress with this as your top issue. Regarding the Washington Post article, it is a blockbuster, and I really think that post-August recess that we have a hearing on this, because there are some very important responsibilities that federal agencies have in this issue. And I think that we have to learn from what has taken place so that it doesn't repeat itself with another product down the road. But for those that have that are affected by it, we have to do much better. I mean, what my colleague just described, that in coal country, there are simply no services. We can't have that in our country. So you carry the weight of the loss of your family. But I do think that as you carry that, that story can help change the overall story in our country. So thank you for being here today, and look forward to working with you.
Thank you.
Thank you, Chairman. Mr. Griffith, go ahead.
Mr. Chairman, if I might add too, I know that Subcommittee Chairwoman Diana DeGette and you and I and some others worked really hard on trying to make sure that our agencies are doing what they're supposed to, particularly the DEA, and that we don't have some glitches in the law that prevents us from doing the things we need to stop the flow of these horrible drugs into our community. So I know that we'll continue to work on that, and hopefully we'll have a hearing oversight as the gentlelady suggested.
Thank you. And thank you, Mr. Trone. Now, the bells went off. We're down to 13 minutes. I'd like to get some of you in, but I don't think we can get all 4, right? So what's the order? Chairman McGovern, Mr. Lipinski. We can certainly get 2 in. I don't know if we can get 3. Why don't but we're never going to get to...
I'll read fast.
All right, we're not going to get to Malinowski, though, I don't think. All right, do you want to come back?
No.
No, not you. I'm going to try to get the 3 of you in, but Tom, can you come back after the votes? We'll see. All right, go ahead, Jim.
Well, thank you, Mr. Chairman, members of the committee. I'm here to testify on behalf of 2 bills, H.R. 2501, the Medical Nutrition Equity Act, and H.R. 3332, which would provide coverage for medical wigs under Medicare. Mr. Chairman and members of the committee, Americans struggle every day to navigate treatments for life-threatening health conditions, and all too often, this battle comes with cost barriers that prevent people from securing treatments that fit their health and personal needs. A few months ago, Congresswoman Herrera Butler and I introduced H.R. 2501, the Bipartisan Medical Nutrition Equity Act. Each year, more than 7,000 infants are diagnosed with an inherited metabolic disorder. These life-threatening conditions prevent patients from digesting or metabolizing most normal foods. Patients often manage their complex nutritional needs with prescribed, specialized formulas, and without them, risk brain damage, repeated hospitalizations, and in some cases, even death. Currently, children and adults who are diagnosed with serious digestive disorders must pay out of pocket for medically necessary food, which can often cost 4 to 5 times as much as the foods that we find in a grocery store. And to make matters worse, most health insurance companies do not cover medically necessary nutrition unless the medication is administered through a surgically placed tube, a costly and ultimately dangerous procedure that in some cases can be avoided. While 35 states have already passed laws to ensure some level of coverage for medical necessary nutrition, that coverage is highly variable and excludes all patients covered under federal programs. The Medical Nutrition Equity Act would establish treatment parity by requiring coverage for specialized formulas, including medically necessary foods, vitamins, and amino acids under private insurance, Medicare, Medicaid, and the Children's Health Insurance Program. And by the way, this coverage, this is coverage that Congress already approved for military families enrolled in TRICARE. The other important piece of legislation that I'm here to talk about is H.R. 3332, which would amend Title 8 of the Social Security Act to provide coverage for wigs as durable medical equipment under the Medicare program. Many patients living with medical hair loss suffer from a variety of diseases, including cancer, alopecia areata, and for those undergoing chemotherapy or suffering from alopecia areata, an incurable autoimmune skin disease that causes unpredictable hair loss, a wig is not just medically necessary, but also essential to alleviating the emotional and social burdens of hair loss. I was inspired to introduce this bill after meeting with one of my constituents, Mary Aframe, who runs the Women's Image Center located in Worcester and Leominster, Massachusetts. Ms. Aframe has worked tirelessly to help raise awareness about the many women undergoing chemotherapy who have trouble affording wigs, particularly those who use Medicare. Wigs can cost thousands of dollars and are out of reach for many patients without help from their insurance provider. While many private insurance plans cover wigs for those undergoing treatments that cause hair loss, this bill recategorizes wigs as durable medical equipment to allow Medicare to provide coverage if a doctor certifies that the wig is medically necessary. This bill will help ensure that every cancer patient and alopecia patient who loses their hair can afford a wig and undergo treatment with the dignity and respect they deserve. So, Mr. Chairman, I strongly encourage you to consider hosting hearings and markups on H.R. 2501 and H.R. 3332, and I look forward to the opportunity to work with you and the members of the Energy and Commerce Committee on this, and I think we need to do right by our constituents and ensure that consistent coverage is standard for all Americans, no matter the illness they have or the health care coverage they require. Thank you.
Thank you, Chairman McGovern. You've been very helpful to us in the Rules Committee. I appreciate that. And Congresswoman Herrera Butler actually mentioned the bill that you highlighted earlier, so we'll follow up. Thanks again. Mr. Lipinski.
Mr. Pallone, Mr. Griffith, Chairman Pallone, Mr. Griffith, Chairwoman Eshoo, I want to thank you for the opportunity to testify today. I want to draw the committee's attention to H.R. 1165, a bill I introduced to address a serious public health issue from a chemical called ethylene oxide, or ETO. Just outside my district in Willowbrook, Illinois, a company called Sterigenics has been using ETO to sterilize medical equipment. This sterilization method is used at many facilities across the country. ETO is a known carcinogen. Last summer, the EPA released a report indicating disturbingly high cancer risk in communities across the country that are home to commercial sterilization facilities, including Sterigenics, that emit ETO. The risk was determined after a lengthy advisory integrated risk information system, or IRIS process, which included extensive reviews of the scientific literature. This review found that the probable cancer risk posed by ETO is 30 times greater than previously estimated. Further, a report released in April by the Illinois Department of Public Health found that certain types of cancer linked to ETO exposure were higher in the Willowbrook community than elsewhere in the state. Specifically, when looking at neighborhoods near the Sterigenics facility, the report found higher rates of Hodgkin's lymphoma in women, pediatric lymphoma in girls, as well as ovarian, breast, and pancreatic cancers. This was obviously frightening news for every community and family in the vicinity of Sterigenics, and a cause of great alarm to others with similar facilities nearby. Thankfully, the Illinois EPA stepped in last February to issue a seal order at Sterigenics and prevent it from using ETO in its sterilization process. But just last week, an agreement was reached to allow the facility to reopen, pending approval by district court. Meanwhile, the EPA has stated for months that it's considering a new emission standards for facilities that use ETO, which would be based on the most recent risk data available. This would provide for direct EPA regulation of ETO emissions and protect people living in communities around ETO-emitting facilities. But the EPA has still not promulgated the standard, slow-walking an issue of profound concern to my constituents. It's also unclear whether the EPA will continue utilizing the best available science to inform the standard by basing its decision on rigorously reviewed IRIS risk values. The EPA must not be allowed to undermine the integrity of scientific process by ignoring established research methods that may reveal unfavorable results. I've been very vocal about this issue because I not only represent thousands of people who live and work downwind of the Sterigenics facility, but I also live nearby. In order to get the EPA to act, earlier this year, I introduced H.R. 1165, the ETO is Toxic Act. This bill requires the EPA to take IRIS assessment data into consideration when setting an ETO emission standard. I request the committee to act on this bill to ensure that EPA decisions on this matter use the best science available. Further, I urge the committee to use its oversight authority over the EPA to investigate whether it is taking appropriate action to protect public health from the dangers of ETO. After years of breathing air with an unsafe cancer-causing pollutant, my constituents and others across the country cannot wait. I thank you for your time and your attention, and I'll yield back.
Thank you, Mr. Lipinski. I want to comment, but we're running out of time before the vote, so thanks again for being here. Mr. Golden, if you want to be quick, we could do it now, but if not, we'd ask you to come back. What do you prefer?
I'll go ahead and be as fast as I can.
All right, thanks.
Chairman, I'm sure you're trying to keep on track today.
All right, thanks.
Thank you very much. Of course, I defer to you if you would prefer to wait. Chairman Pallone, Mr. Griffith, Ms. Eschew, thank you very much for the opportunity. I'm here to testify about the Flat Prices Act, H.R. 1188. It's a bill I'm proud to lead to address the issue of rapid increases in prescription drug prices. I'm honored to have the support of Mr. Caston, Ms. Slotkin, Mr. Cisneros, Mr. Rose, Ms. Pingree, and Ms. Finkenauer. I'm glad to be working in partnership with Senator Durbin, who leads a companion bill in the Senate. Traveling around Maine's 2nd District, this is a top issue, rising price of prescription drugs. We are a very old state. In fact, per capita, we are the oldest state. My constituents, prescription drug prices is critically important to them. And we've seen, obviously, over the years, a lot of coverage about spiked prices, efforts to make a quick buck on the backs of people who are relying upon these prescription drugs. And examples such as Martin Shkreli raising the price of HIV/AIDS drugs, by about 5,000%. I know you're all familiar with this. Mylan and EpiPen prices going from $50 to over $600. Insulin prices have consistently increased in recent years as well, with the average price nearly doubling between 2012 and 2016. This issue isn't just a few well-known bad actors. According to AARP, retail prices for a set of more than 250 widely used brand name prescription drugs increased by an average of more than 10% each year from 2010 to 2016. These price increases have forced some families, particularly seniors, to make very difficult decisions between buying life-saving medications and putting food on the table, paying rent in a place like Maine, very cold in the wintertime. Often that trade-off has to do with heating your home or getting your medications. I've introduced the Flat Prices Act with this data and these real-world impacts in mind. The bill would help put a stop to immoral price gouging by helping generic competition come to the market faster. The Flat Prices Act would reduce a drug's market exclusivity period if its price spikes by more than 10% in 1 year, 18% over 2 years, or 25% over a 3-year period. The penalty for exceeding these thresholds would be a reduction of 180 days for the drug's exclusive monopoly period, and the period would shorten by an additional 30 days for each 5% price increase above these thresholds. With this bill in place, pharmaceutical companies would be discouraged from steeply hiking their prices, and if they did so anyway, consumers would have less time to wait before generic alternatives would become available to them. I applaud this committee for its recent action to advance a number of bills related to drug pricing, and I hope that you will consider including the Flat Prices Act, which has been referred to this committee, in a future set of bills to control health care costs. I particularly like the bill because I think it takes a tiered approach that matches the issue. For those who are most abusive, this bill would be most effective in doing something about price gouging. For those who perhaps are price gouging a little bit less so than some of these worst of examples, it would be less of a penalty. But it does recognize that these companies have an exclusivity period because they've made big investments up front, and that they start with a price, and costs may increase. We're not trying to stop companies from recovering the investments they've made. We're just trying to protect consumers from abusive behaviors.
Well, thank you, and we just got to wrap up, but obviously this is a huge priority for us in the fall. We're going to be moving and looking at these various bills on negotiated prices under Medicare, and we know the problem is particularly acute for seniors. And Ms. Eshu, certainly, this is a priority for her too. So I'm just going to adjourn now, if that's all right. And we're going to, not adjourn, we're going to recess until 2 o'clock, but thank the gentleman from Maine.
Thank you for the opportunity.
The committee will reconvene, and I assume Mr. Whitman is, thank you for being here. Proceed.
Thank you, Mr. Chairman. I want to thank you and the committee members for the opportunity to come and speak to you today. And I represent the 1st District of Virginia, which faces a number of unique challenges in expanding broadband. The 1st District spans the I-95 corridor in Northern Virginia, which includes some of the foremost tech companies and data centers in the nation, and continues southeast to the Northern Neck and Middle Peninsula, which is home to some of the most underserved rural populations in Virginia. Citizens in more urban areas in the northern part of my district benefit from the highest quality broadband the market has to offer. With access to speeds upwards of 1 gigabyte, these citizens have unfettered access to services such as telemedicine, online education, and modern business applications and technologies that allow businesses to compete in the 21st century. These services are a convenience that many folks have come to take for granted in 2019. This is not the case in the more rural parts of my district. As population density decreases, the business case for providers simply is not there to extend service to these unserved areas. Many communities and neighborhoods throughout the Northern Neck, Middle Peninsula, and stretches of Stafford County, and localities east of Richmond, like the localities of New Kent and Hanover, struggle to gain access to reliable broadband. As a resident of this area who drives back and forth to D.C. every day during session, I understand firsthand the plight of rural residents when it comes to gaining quality high-speed access. In rural areas, broadband is oftentimes the top issue I hear about, as mothers and fathers complain about late nights sitting in the McDonald's parking lot as their kids use the Wi-Fi to finish their homework. Children of elderly parents plead for quality broadband to access telemedicine services so their parents don't have to drive an hour plus to the nearest health facility. Or business owners that know better quality broadband would allow them to grow their businesses. Demand for high-speed broadband has never been greater. Closing the digital divide is the key to lifting up countless communities and populations in unserved areas. While Congress has made great strides in tackling this issue, more can and should be done. Further emphasizing policies that promote public-private partnerships is essential. As I mentioned earlier, as population densities decrease in rural areas, P3s incentivize providers through an influx of capital funds to build in areas where the business case would often not exist without it. Addressing our nation's broadband mapping capabilities is also important to closing the digital divide. It is no secret our broadband maps can be wildly inaccurate and often lead to overbuilding on already existing networks. I'm an original co-sponsor of H.R. 3162, the Broadband Data Improvement Act of 2019, which would require providers to report data on geolocation basis to create an improved national broadband map that better targets funding to the areas that need it most. Another important element in preventing overbuilding is through instituting challenge processes. H.R. 3162 establishes a periodic challenge process at the FCC by which the public and incumbent providers may challenge data on the national broadband map. The FCC must then analyze any challenges that may suggest the map is inaccurate and resolve any disputes to update the map accordingly. I strongly urge the committee to mark up and pass this legislation and any other similar legislation with such measures so that we can advance them to the floor for a vote. Lastly, we must continue to eliminate the labyrinth of red tape and regulations that continue to hinder shovel-ready projects and streamline our federal permitting process. Mr. Chairman, I want to thank you and Ranking Member Walden and members of the committee for the opportunity to testify today. Thanks so much for your leadership. And as co-chair of the House Rural Broadband Caucus, I offer my assistance on the subject and would certainly love to work with you on these items to help close the digital divide, not only in my district, but across our United States.
Thank you. Several members have talked about the need to expand broadband into rural and underserved areas, and that's one of the things that we definitely are striving for. We have a bill called the Lift America Act that would spend like $40 billion on that as part of a larger infrastructure package. So we're going to look at this very seriously. Thank you.
That's great, Mr. Chairman.
You want to?
I concur. Thanks, Rob, for joining us today.
Thanks a lot. Appreciate it.
Thank you, Mr. Chairman.
Take care. Mr. Malinowski, thank you for coming back after the votes.
Thank you for having me back. Thank you, Mr. Chairman, Mr. Flores, members of the committee. I very much appreciate the chance to testify. You have a very broad jurisdiction, obviously. I'm going to focus on just one issue. I'm here on behalf of the 168,000 people in New Jersey who have been hit with medical debt due to surprise billing. Each year, through no fault of their own, in my state, in our state, these folks owe an extra $420 million. We often hear about surprise billing happening during medical emergencies. A person is sick or injured, an ambulance is called, and later they're hit with a huge bill because either the ambulance or the hospital or the doctor they saw was out of network. I recently spoke with a constituent whose husband had a cardiac emergency. She called local emergency services, who then called a hospital to send an ambulance with cardiac equipment. After her husband was released, they received 4 separate bills totaling thousands of dollars. Their insurance was covering less than half. While the hospital where he was taken was covered by the family's insurance, the couple was unaware that the ambulance, which was associated with the hospital, was out of network. How could they know? How could they be expected to know such a thing? It is a true testament to how broken our healthcare system is that during our worst moments, when we are most vulnerable, when we are sick, injured, worried about getting better, staying alive, we are also burdened with the responsibility of ensuring that our ambulance, our hospital, every single doctor that examines us is covered under the insurance we pay for each month. Surprise billing, of course, does not just happen during emergencies. A patient can book an appointment with a doctor in network and only find out later that one of the medical professionals she saw actually worked for a third party and was not covered. Anesthesiologists, radiologists, surgical assistants, often entire departments within an in-network facility might be operated by subcontractors and therefore be out of network. 7 in 10 people who have been hit with unaffordable out-of-network medical bills were not aware that the healthcare provider they saw was not in their plan's network at the time of receiving care. Now, last year, New Jersey passed our own law that clearly prohibits charging patients more than what we would normally owe under our insurance plans for urgent and medically necessary services or inadvertent out-of-network services. There is no good reason why we should not do the same for every American. Patients who are no way at fault should not be responsible for astronomical fees they were not warned they were incurring. Mr. Chairman, one last broader point on this. There are many things that Republicans and Democrats sincerely disagree about in this body. I don't think that this is one of them. I don't see any philosophical difference amongst us about whether people should be stuck with massive surprise medical bills, just the challenge on agreeing on the practical details. It is one thing to have gridlock when we disagree if we cannot deliver on one of the few issues where we do stand on common ground. That would further diminish our constituents' faith in this institution. So I would say the stakes are pretty high. I thank you for your work on this issue, which I know has been bipartisan in this committee. I look forward to being part of that and hope very much that we will come to a solution soon. Thank you very much.
Well, thank you. Ms. Eshoo?
I want to thank you for being here today, and I agree with everything that you've said. Actually, the chairman and the ranking member of the full committee are the chief sponsors of what you just described. We've worked hard on the bill. It came through the Health Subcommittee to the full committee on a bipartisan basis. And I don't know if you've read the bill.
I have, yes.
You have?
Yes.
And do you have if you have any particular views where you don't agree or you think the legislation can be improved, let us know. But I think
will.
it's on its way, and we look forward to it going to the floor for the full House to pass it post-August recess.
I hope so, too.
I appreciate what the gentlewoman said. I just wanted to make 2 remarks. First of all, I was surprised to find out that in our state, generally across the country, the federal bill, I think there are about 12 states that have their own laws, including California and New Jersey. And so obviously for the states that don't, this would be even more important, right? Because they don't have any state legislation. But even in the states that do, it generally doesn't cover, the large self-insured, ERISA plans. And Coughlin, who's from my district, and he said that in New Jersey, it was reversed. In other words, the state law only covers about a third, and the federal law would cover the other 2/3, which was, I thought, interesting.
Yeah, and even people covered by the state law aren't necessarily aware that they're protected. We've actually, my district office has had to help some of our constituents who actually are covered.
Yeah.
Obviously, we've referred them to the state government, and the insurance companies and the hospitals have not fully adjusted to the new reality in our state. So I think a national law, even in states where we've taken this step, would be very, very important in ensuring that everybody in the complicated system understands that this has changed and must change.
And then the other thing, not to belabor it, is you mentioned ambulances. We would very much like to cover ambulance. We do cover the air ambulance, the helicopters. The problem in covering ambulance, though, is just so complicated because a lot of them are, some's private, a lot in New Jersey in particular is, the community first aid squad, the local government. So we're looking at it, but it is difficult for us to cover ambulances because of the way they're set up and paid for. But we are looking at it, so I wanted to mention that.
Good.
Did you want to add something, Mr. Flores?
Yes, Mr. Malinowski, thanks for joining us today. This is an issue that cuts across all states and all populations, and we appreciate your input.
Thank you, sir.
Thank you, Tom.
All righty.
Thank you. And now the gentlewoman from Puerto Rico. Good to see you here.
Thank you, Chairman Pallone, for your visit to Puerto Rico and the commitment you have shown many years for the island. Ranking Member Flores, again, and Chairwoman Eshu for all the help during the last legislation of the past week. And same thing to Peters here today. I want to thank all for giving me the opportunity to discuss legislation that I have introduced that could be brought before the committee. I also want to thank this committee for taking a critical action last week by passing the Territories Health Care Improvement Act, which provides critically needed resources to the territories' Medicaid programs to ensure sustainability while a more permanent legislative solution is developed. According to analysis undertaken by the Department of Health and Human Services, American living in poverty have significantly constrained budgets that limit their ability to pay out-of-pocket healthcare costs. Those in deep poverty have literally no available income after they pay for their most basic necessities each month, necessities which do not include healthcare, childcare, or transportation. People in poverty tend to be less healthy than those with higher incomes and therefore need more medical care. However, people in poverty are often unable to afford even nominal premiums and co-payments. Research shows that they may forgot necessary medical treatment as a result of required cost sharing. Having said that, Puerto Rico's population is a prime example of all these findings, with a median annual income of $19,000, close to half of Puerto Rico's residents live below poverty level and depend upon the public health system for their medical care. Additionally, residents of Puerto Rico are ineligible for supplemental security income solely because they live on the island, because of our zip code. They are also ineligible to receive assistance in payments other than Medicare Part B and Part D premiums. Residents of Puerto Rico bear the heavier burden of healthcare costs than residents of the states and the District of Columbia. In order to triage this situation while Congress develops a permanent solution, I filed the following bills that await action before this committee, all of them in a bipartisan way. H.R. 813, the Puerto Rico Integrity in Medicare Advantage Act. In the case of Puerto Rico, almost more than 80% of our people are using the Advantage program. This bill revises the Medicare Advantage payments for 3 years by establishing a 0.7% adjusted general average floor to any county in the nation that exceeds this benchmark. Two, it requires that at least half of the additional funding above and beyond the 85% rule be used to increase provider payments. And the reason for that is we are losing a lot of our physicians and service providers. And it will support Medicare Advantage Coordinate Care platform, which with performance-based and quality standards in care, which serves as the backbone of the healthcare system in Puerto Rico as well. I also introduced HR 2172, which removed the matching requirement for Medicare Part D drugs in Puerto Rico. While assistance is available for Medicare beneficiaries in the states and in the District of Columbia, beneficiaries who reside in the territories are not eligible for low-income subsidy, or LIS. In lieu of the LIS, Social Security provides a block grant to each territory for Medicaid coverage for low-income beneficiaries' prescription drugs. In the case of the island, the FMAP has been set to 55%. Between fiscal years 2010 and 2016, Puerto Rico has been able to drown down only 51% of its available federal funding for prescription drugs and for low-income Medicare beneficiaries. Lastly, I introduced the HR 2310, the Fairness in Medicare Part B Enrollment Act, to address the fact that the residents of every state and the territories other than Puerto Rico who are receiving Social Security benefits are automatically enrolled in both Part A, Part B, with coverage beginning the first day of the month when they turn 65. When someone who is receiving SSI in Puerto Rico turns 65, they are enrolled in Medicare Part A, but not in Part B, which has resulted in 38,000 Medicare beneficiaries paying a lifetime late enrollment penalties of $20 million a year. And with that, Puerto Ricans deserve equality in health care, just like every other U.S. jurisdiction, by enrolling in Part B automatically. Approximately 40% of the residents of Puerto Rico who are 60 years and older live below the poverty level with an annual income of less than $12,000. The Part B premium of or about 15% of their monthly income can be cost prohibited, and in the absence of other Medicare Savings Program options available across the nation. With that, I would like to thank you all, and again, I ask the committee to take up these bills in a favorable way.
Well, I want to thank the gentlewoman. I mean, you know, I feel personally, I know a lot on this committee, that we really need to do a lot more with Puerto Rico and the territories. And when we went on that two-day mission or whatever, Codell, with you and Stacy Plaskett, we learned a lot, and not only about what we had to do with Medicaid, but also the electricity grid and so many other things that we will still follow up with. And thanks for all your input in putting together the Medicaid plan, which we expect will move, you know, hopefully the first week or soon after we get back. And we're working with the Senate on it too, so thanks again. Did you want to add anything, Ms. Eshu? Or?
Well, I think that I'm very glad that we got the legislation done when we did. And it is, I think it's going to go a long way. It's not going to close the loop on everything because the territories are still not going to be treated the way they should. There is not equity there in the American citizens, but thank you for the work that you've done on it, and I look forward to it passing when we come back, right?
Right, thank you.
So we'll have some good full floor days just from what comes out of our committee, Mr. Chairman. Thank you.
And we'll still look to, you know, beyond the 4 years too. You know, we know we have to do a permanent replacement, so thanks again, Jennifer, thanks. All right, next we have the gentlewoman from Iowa, Ms. Finkenauer.
Well, thank you, Chairwoman Eshu, and also Chairman Pallone for the opportunity to speak here today. While I don't serve on this committee, I am proud to be a voice for Iowa's working families, and I'm committed to making sure that they have a seat at the table on issues affecting their lives. And one of the most significant burdens Iowa families are facing is the skyrocketing cost of prescription drugs. It's something that I've heard from folks all around my district at town halls, but then also things that I call conversations with your congresswoman, which are modeled after kitchen table conversations I'd have with my grandfather and my uncle. My grandfather was a Democrat, my uncle was a Republican, and we'd sit around the table talking about issues that mattered. And I remember, we could leave and, disagree on some issues, but still have respect for each other. And when it comes to prescription drugs, that's something where Democrats and Republicans, especially in my district, are concerned about and can find common ground. In the first half of this year alone, we've seen over 3,400 drugs boost their prices. The average price hike, 10%, 5 times the rate of inflation. The cost of insulin, for instance, has risen over 500% in recent years. It's left a lot of Iowans with diabetes who have been managing their condition for years wondering what's changed. Seniors on fixed incomes are especially burdened by the rising cost. No one should have to choose between retiring in dignity, keeping their home, or affording the medicine that allows them to live their lives. Yet, 3 in 10 Americans report not taking their medicines as prescribed because of cost. Stevie is a mom in Iowa. She has said she has her son's doctor write her son a prescription for a less effective medicine because that's all she could afford. She couldn't afford to pay for the drug that the doctor originally prescribed for her son. She told the doctor that giving her son a less effective medicine was better than none. No mother, no American should be put in this situation. We live in the most innovative country in the world. There is no reason we cannot come together and find the best policy solutions to reduce cost, putting money back in the pockets of Iowa families and families across the country, and getting folks the care that they need. I have proudly supported bills like the CREATES Act and the Protecting Consumers' Access to Generic Drugs Act. I appreciate this committee's work to bring legislation to the House floor that would require more transparency from drug manufacturers and will make it faster and easier for more affordable generics to come to market. I encourage this committee to just continue its important work to hold drug companies accountable and bring down the cost for patients through common sense bipartisan legislation. I'll continue to work with anybody who is serious about helping Iowans and helping Americans get better, more affordable health care. And I am ready to work with you, and I support you in your efforts to tackle the skyrocketing cost of prescription drugs. I am truly grateful again, Chairwoman Eshoo, for inviting us today to have these voices heard, and thank you for your efforts, and I'm continuing ready to keep the work going with you guys. Thank you.
Thank you. And, many members today talked about prescription drugs as their priority, and we appreciate your mentioning that we did, as you know, move the, and these are bipartisan, the generic competition bills, the transparency bills, which we did last week, which should move when we come back, and we're working on negotiated prices bill under Medicare as well. So, we're right. You're right on point in terms of what we're trying to accomplish. Thank you. And now we have the chairwoman of the Appropriations, Labor, HHS, Education, and practically everything else subcommittee, longtime champion of trying to expand access and affordability for health care. Thank you for being here.
Thank you very, very much, Mr. Chairman. It's wonderful to be here with you today. I thank the ranking member. Just please give him my best, but also to my colleague, Congresswoman Eshoo, Dr. Burgess, Congressman Carter, and Mr. Peters. Thank you all very, very much. This is a wonderful committee which is dealing with some of the most important issues that we do face in our country today, and particularly those around health care. I'm here to advocate for Medicare for America, which is a proposal in your jurisdiction that I have introduced with the chair of the Consumer Protection and Commerce Subcommittee, Congresswoman Jan Schakowsky. It is our proposal to achieve affordable, quality, universal health care. Right now, families are struggling with the skyrocketing cost of prescription drugs and health care costs costs which continue to far outpace people's wages today. They are paying more for worse coverage than they may have had previously. In fact, according to the Kaiser Family Foundation, premiums increased 65% in 10 years for a single person who gets their health insurance. Meanwhile, their average deductible went from $303 in 2008 to $1,350 in 2018. As a result, 1/3 of Americans have delayed care due to cost, and that's according to Gallup. All the while, the administration is making intentional policy choices to undermine the Affordable Care Act, raise prices for middle-class families and for working people. In the Labor, Health, and Human Services Subcommittee, we hosted a hearing about what I regard this as sabotage of the Affordable Care Act. A study out this week found that 15,600 deaths would have been prevented if all states expanded Medicaid and the Affordable Care Act as intended. It was those problems we aimed to solve long-term with Medicare for America. Medicare for America achieves universal, affordable, high-quality health coverage by creating a program based on Medicare and Medicaid. It expands the benefits and services to include items like prescription drugs, dental, vision, hearing services, and long-term services and supports. Medicare for America would be accessible to all Americans through auto-enrollment while maintaining private insurance for those employers who provide comprehensive, high-quality, and affordable plans. Right now, 165 million Americans receive their coverage through their employer. And what we do is we maintain employer-sponsored health care. Many people are happy with it. Companies may continue, as I said, to offer these plans, or they can enroll employees in Medicare for America, contribute 8% of annual payroll to the Medicare Trust Fund. Employees have a choice as well. They can choose to enroll in Medicare for America instead of their employer-sponsored plan and have their employer contribute to it. Medicare for America addresses costs. Annual out-of-pocket costs are no more than $3,500 for individuals, $5,000 for families on a sliding scale. There are never out-of-pocket costs for preventive and for chronic disease services, long-term services and supports, and prescription drugs, generic or brand name as necessary. There are also zero deductibles, zero. And premiums are capped, no more than 8% of income for enrollees. So for those between 200 and 600% of the federal poverty level, between $50,000 and $150,000 for a family of four, premiums are subsidized. For those under 200% of the federal poverty level, $50,000 for a family of four, there are zero premiums and zero out-of-pocket costs. Second, we address benefits. Currently, health care benefits are largely dependent on your zip code, and Medicare for America fixes that. Regardless of whether you live in Connecticut, in Mississippi, Utah, California, every single American should have robust, comprehensive health coverage. So we set a very high standard for benefits. We cannot wait for states to do the right thing and increase benefits and services. Doing so will only continue and compound the inequalities that we are trying to rid from our healthcare system. Third, we ensure Americans have access to long-term services and supports. And this is with regard to disabilities as well, emphasizing home and community-based care that recognizes the central role that family caregivers play. Fourth, we restrain system-wide costs with all-payer rate setting and by allowing the government to negotiate for better prescription drug prices. What we have included as well in Medicare for America is how we will be paying for it. Medicare for America sunsets the Republican tax bill. It imposes a 5% surtax on adjusted gross income, including on capital gains, above $500,000. It increases the Medicare payroll tax and net investment income tax. We also increased the excise taxes on all tobacco products, beer, wine, liquor, and sugar-sweetened drinks. State will also need to make maintenance of effort payments equal to the amounts that they currently spend on Medicaid and on CHIP. You know, this is a quick overview of the bill. When working people are struggling with stagnating wages, skyrocketing healthcare costs, we need to do more to help them out. So as the committee continues to consider how to bring down costs for families and working people, I urge you to consider Medicare for America. I believe it would achieve universal coverage, which is, I know, our shared goal. And I thank you so much for the opportunity to be with you today. Thank you.
I thank the gentlewoman, the chairwoman. You've been involved with so many of these healthcare affordability and accessibility issues for so long. I don't even know where to begin to thank you. But I do want to say, obviously, we'll, take a look at Medicare for America. But in terms of what the committee's done, in our first 6 months here before the August recess, we've been trying to basically, look at shoring up the existing programs in marketplace, whether it's the Affordable Care Act or generic competition or the transparency bills. But, we are, in the fall, we'll start looking at, innovative things. When you talk about long-term care, you and I both wanted to include a long-term care initiative in the Affordable Care Act, and we just ran into the cost problem with CBO. I usually blame CBO for everything, in case you haven't noticed. And, in terms of the negotiated prices for Medicare, that's something that we're certainly working on. Home and community-based care, the list goes on. So I just want to thank you. I want you to know that we are going to be looking at a lot of these gaps that exist, because there are some, and certainly, idea of capping or, trying to reduce out-of-pocket costs is very important as well. So thank you.
I appreciate that very much, and longtime supporter of, obviously, the Affordable Care Act. And I don't see, what I do see is that, there's being able to achieve universal health care, build on that, take a look at new opportunities at the time when you can also be very, very mindful of employer-sponsored insurance and those 165 million people who take advantage of that, and you just can't put them aside, but to allow them to be able to either opt in or their employer to opt in, and at the same time, look at a way in which we begin to auto-enroll people from birth, so that we begin to get them into the system. And above all, I know you're conscious about cost, and so that what we do is to provide a way and to look at how one pays for this. So I appreciate the opportunity.
Absolutely, thank you. Dr. Burgess or Ms. Escher, did you want to say anything? No? Chairwoman Escher.
Rosa, thank you for coming here today. Your energy is infectious. You're a force of nature. And your ideas are always very important ones and large ones. It represents big thinking, but underneath it, the thinking continues. It's not just the big tagline. So I remember years and years ago in the Clinton administration, we tried to set up an early buy-in to Medicare for people younger than 65. We weren't successful with that, but I think that you make a very important point about the following. It's estimated to be anywhere from 165 million to 180 million people who receive their health care through their employer. That is not something we can ignore. Absolutely. But those of us who have spent our adult lifetimes working for universal coverage for every person in this country, so that every person in this country is covered, we want to make sure that they're not thrown on the scrap heap of humanity if they lose their job. So we don't know what's going to happen to the Affordable Care Act, but I think that you've brought forward a thoughtful plan. You might think of doing some workshops with members on both sides of the aisle so that they understand what's in your proposal. And what the estimates would be, what it would cost a family, an individual, how long, what it would include. I mean, you've talked about some of those things today, but thank you.
Thank you very, very much. Thank you for the suggestion. I
Yeah,
appreciate it.
good. And I'll come too. Thank you. Thank you, Rosa.
So you brought some interesting ideas, most of which I probably don't agree with, but the concept that we should be talking about
You
that
agree with universal health care, Dr. Burgess.
in this committee, I think is important. And I suppose a competing bill with yours would be the Jayapal bill. And I know Representative Dingell on our committee has been interested in that. We actually had a hearing in the Rules Committee much earlier in this Congress. I don't understand why it was the Rules Committee, not our committee. I think we are the committee, we are the authorizing committee of jurisdiction. This should be open for our consideration. I know the chairman does not like association health plans, but I think that is going to be part of the argument. Health reimbursement accounts, which recently were allowed under rulemaking by the administration. And yes, I did complain about executive actions under the previous administration. I do think we ought to be doing the if ideas are good ideas, we ought to authorize them and bring them through the legislative process. But a health reimbursement account where where an employer is allowed to give a person a fixed amount of money outside of what would be taxable so that they can walk that into whatever exchange or insurance product that they want. After all, that's what most members of Congress have in the DC exchange in the Affordable Care Act. So if it's good enough for members of Congress, it should be good enough for the general population. But I'm willing to consider all of these ideas, and I think we should have a robust and lengthy hearing and have this same sort of perhaps member day structure on this, because I know many members do have their own ideas. Interestingly enough, when all of the excitement was toward the Medicare for All when we had that hearing in the Rules Committee. And yes, as you point out, it would end employer-sponsored insurance, it would end Medicare Advantage, it would end TRICARE. So there were a lot of things that people were doing today that they liked that they would lose, and I think that is a valid consideration and one that I perhaps brought up that morning in the Rules Committee and then lost in the translation. The same day the Mueller report came out, coverage numbers were released by the Congressional Budget Office, and yes, we have our differences with the Congressional Budget Office, but 2.6 million more people had employer-sponsored insurance. 2.6 million people since January of 2017 now had this coverage, so that's a good thing, and we should celebrate that. And my opinion, we shouldn't try to take that away from them. So it's an interesting concept. This committee is where it belongs. We're the only committee that hasn't really had a hearing. And the Budget Committee's had a hearing, Rules Committee's had a hearing, Ways and Means Committee has had a hearing. Our turn, and we're next. Thank you.
Thank you very, very much. I appreciate staying in your lane, too. So I understand the relevance of the Energy and Commerce Committee. Thank you.
Thank you, Madam Chairwoman.
Thank you.
Thank you. The gentleman from Tennessee.
Thank you, Mr. Chair. I appreciate you, and I appreciate Rosa for that pat on the back. That was nice and rubbing. You don't have to stop. And I want to thank the members for allowing us to bring our suggestions to the Energy and Commerce Committee and this subcommittee on health. I appreciate your time and the leadership of Chairman Pallone and the committee in this 116th Congress. As we meet in the room named for the champion of healthcare, Mr. Dingell, and as I look at Henry Waxman looking down on me, I know that there are giants in this committee that have done much for healthcare over the years. I am a proud sponsor of HR 117, it's an acronym, Newborn, and that's nationally enhancing the well-being of babies through outreach and research now. Pretty good acronym, thanks staff, which builds from the belief that health care is a basic human right. The newborn bill was introduced way back in like 2010 or 2009 the first time, and it was part of the Affordable Care Act, and it would have been included therein, but for some mistake that Chris Dodd made, and I haven't forgiven him. the Democrats used it as a way to promote the health care, and it was a highlight of what we were doing, put out to members that we're going to have this Newborn Act as part of the health care bill. I guess it's when we had to deal with the Senate bill that we had the problem. The Newborn Act gives a voice to children who've been taken by our country's ongoing crisis of infant mortality. 54 developed countries have lower rates of infant mortality than the United States. As the wealthiest country in the world, the United States, we should not be 55th. As members of Congress, we should be ashamed. In fact, John, whatever his name is, The Daily Show ought to be here giving us hell. Yeah, Jon Stewart. The Newborn Act would help address this problem by creating infant mortality-focused pilot programs in the highest risk areas of our country. The pilot programs would focus on addressing the top 5 reasons for infant mortality: birth defects, preterm birth and low birth weight, sudden infant death syndrome, maternal pregnancy complications, and/or injuries to the infant. These deaths disproportionately affect black women. My district is predominantly black and predominantly black women. It's estimated that 9 out of every 1,000 children born in the district will not see their first birthday. By focusing studies in the highest risk areas of our country, the Newborn Act directly confronts this disparity. Its pilot programs would provide insightful data and immediate support to areas with the highest rates of infant mortality. So I would encourage the committee and ask the committee, beseech the committee, to have a hearing to consider the immediate threats the maternal and infant mortality crisis poses to women and children, especially African American women. It's our duty to act, and I believe the Newborn Act would be a crucial step forward. I know Dr. Burgess knows these issues too. As a pediatrician, he sees it, but it's really awful in Memphis. We have rates with third world countries. So that's my ask, and I appreciate the opportunity to address you.
I want to thank the gentleman. You know, I know your interest in the newborns. This is very important, and we're certainly going to take a look at it. We did a newborn screening act bill yesterday, but this is different.
This is different. We set a pilot program in the more difficult, the highest districts with the highest.
Right. So we'll take a look at it and get back to you.
When it was in the ACA, everybody thought it was great, held it up. This is great. And Chris Dodd messed up, so we need to help Chris Dodd redeem his reputation.
All right. And let me mention all of you, you know, we're having this hearing today, but you can follow up with either us on a member basis or your staff on anything that you might want to mention as well. So thanks a lot, Steve.
Thank you.
Thank you.
Mr. Chairman,
I'm sorry. Go ahead, guys.
I'm sorry, go ahead.
Chairwoman?
Thank you for coming, Steve. I think that you have a very good bill, and as the chairman said, we'll take it under consideration. I just, I know that, I assume that you're just casting Chris's name around tongue-in-cheek, correct? Yeah, okay. This is a brother-friend, so we just have to make sure. Okay, thank you.
Dr.
And
Burgess?
Mr. Chairman, just to correct the record, I am not a pediatrician. My specialty was obstetrics and gynecology.
Then you were even more informed, and I would just knew it but didn't say it.
Thank you, Mr. Cohen. Next is the gentleman from Ohio, Mr. Balderson.
Thank you, Mr. Chairman, members of the subcommittee. I am here today to discuss an issue that is important not only to me personally, but also to the thousands of Ohioans I represent. Roughly a quarter of the district I represent, Ohio's 12th congressional district, is comprised of rural areas. I was born and raised in one of those rural areas, the Appalachian community of Zanesville, Ohio, where rural broadband is of critical importance. As you know, this subcommittee has jurisdiction over telecommunications issues. Unfortunately, many of my constituents, as well as millions of Americans, don't currently have access to high-speed broadband internet, which puts them at great disadvantage to their peers who live in more urban, connected areas. As a Congress, we are failing those Americans. In an increasingly digital area, rural Ohioans and Americans from around the country require access to modern broadband e-connectivity as much as those in urban and suburban communities. With a connection to high-speed internet, rural Americans gain every important access to healthcare services through the option of telemedicine and tools to fight the opioid epidemic, have increased capacity to grow their small businesses by opening up the digital marketplace to small businesses so they can compete and benefit from drastically improved educational opportunities by providing rural students the same ability to research, access educational materials as their urban and suburban peers. Without access to these high-speed internet standards, rural Americans suffer from a disadvantage in connectivity to the online world. According to the U.S. Census Bureau, 1 in 5 Americans live in a rural area. Rural farmers supply food for our country, rural labor keeps our manufacturing base strong, and rural energy exports keep America powered. Yet, for all they do for our country, the Federal Communications Commission recently found that more than 30% of rural Americans do not have access to basic broadband services. In comparison, only 2% of urban Americans experience the same lack of connectivity. We as a Congress have the opportunity to level the playing field by helping rural Americans access critical services by supporting rural broadband e-connectivity. According to the USDA, rural broadband e-connectivity puts the United States at the top of the world's productivity by fostering economic development, job growth, rural entrepreneurship, and innovative technologies. The USDA also found that enhanced connectivity in rural communities leads to important markers for success, including an increase in productivity for farmers through the use of smart farm equipment and crop-focused innovation, an expansion of entrepreneurship in a global digital marketplace, an improvement in business operations through small towns' ability to respond to market conditions, support farmers' ability to predict production inputs, increase yields, and access potential customers worldwide, an expansion of educational opportunities, and finally, an enhancement of healthcare options by enabling healthcare professionals to spread awareness of local resources. As you can tell, rural broadband access would do a world of good for millions of Americans currently living without this resource and would give our country an advantage in the global space. This is why I will continue to be a vocal advocate of this issue and why I am proud co-sponsor of H.R. 3162, which would require broadband providers to create an improved national broadband map that is significantly more accurate and granular, as well as subject to an ongoing and multifaceted challenge and refinement process. I ask you all to consider the millions of Americans who are starving of access to rural broadband to e-connectivity. These rural Americans are no less deserving of the opportunity than to succeed than their peers. Thank you all for your time, and I welcome any questions that you may have.
I want to thank the gentleman. We stressed earlier, a number of those people, a number of our colleagues that have been here have talked about more attention to rural areas, particularly with broadband, and we're very much aware of that and want to prioritize expansion of broadband in rural and underserved areas, and that's part of our Lift America Act, which would be a larger infrastructure bill. So I just want you to know that we're very cognizant and follow up on the things you mentioned. Did either of you want to? No? Go ahead, Dr. Burgess.
Mr. Chairman, I don't know if you're aware that Mr. Balderson, of course, joined us as a result of a special election last year. So this is not his first term, technically. But his predecessor was my counterpart on the Ways and Means Committee, the chairman of the Health Subcommittee on Ways and Means, Pat Teaberry. So welcome, Mr. Balderson. We're glad you're here. And I acknowledge, as the chairman does, that what the issues that you bring to us is important. My district is, the district that I represent is no longer as rural as it was when I grew up. It's about half rural and half urban now, but the rural half, certainly the broadband issues are significant and an issue that I've worked on for several years. So we work on things like telehealth. It is important that be available and reliable and be within the range that people can use it. So thank you for bringing this to our attention today.
Thank you very much.
Thank you again. And now we have, oh, I'm sorry, Mr. Peters has a comment or question.
I just want to quickly comment that to Mr. Balderson, I have not heard any discussion of a large infrastructure package in this building on either side of the aisle, which doesn't include rural broadband. We see it as an access issue, as a investment issue, and as an infrastructure issue, and so we'll look forward to working with you on that.
Yes. Thank you very much. Thank you, Mr. Chairman.
Thank you. And now we go to Mr. Hearn from Oklahoma.
Thank you, Mr. Chairman, and the members here for allowing me to testify today. I want to thank the Energy and Commerce Committee for passing H.R. 3375, the Stopping Bad Robocalls Act. This is an important piece of legislation that I proudly co-sponsored and the House of Representatives passed overwhelmingly yesterday. We've all received spam phone calls before. They are annoying, harassing, frustrating calls during all hours of the day and night. I sometimes get as many as 20 fake phone calls per day. These robocalls are frequently coming from your own area code, a trick that makes us all extra vulnerable to this epidemic. Con artists are manipulating the incoming phone numbers in order to gain the trust of the American people to steal money and personal information from their unsuspecting victims. It is criminal, and it is long overdue that we do something about this breach of trust. It is urgent that we shine some light on the pressing and increasingly frustrating issues of robocalls. Currently, robocalls make up about 50% of all phone calls. In 2018, there were more than 47 billion robocalls in the United States, an increase of 17 billion from the previous year. And this year, according to AARP, we are on track to receive a record 60 billion illegal robocalls. In my home state of Oklahoma, robocalls are received over 55 million times per month, about 75,000 calls per hour. That's completely absurd. Oklahoma state officials are working tirelessly to solve this issue on a local level, but the scope of this abuse requires federal intervention. Therefore, I want to thank Oklahoma's Attorney General Mike Hunter, who has met with Federal Communication Commission Chairman Pai to do his part in ending the robocall epidemic in Oklahoma. For rural Oklahomans, their phone may very well be their lifeline, and robocalls block the lines, putting their very lives in danger. Additionally, robocall epidemic is also a public health crisis that is plaguing our hospitals and healthcare facilities' phone lines. The people with life-threatening illness and the elderly who rely on their phone as their lifeline. These phone calls can get in the way of life-saving help. When a person is trying to contact a hospital, every second counts. A blocked phone line due to a spam call can mean life or death to a patient. For example, in the heart of Boston at Tufts Medical Center, administrators registered more than 4,500 calls within a 2-hour window just last year. Many hospitals around the country share this experience. In Congress, I've made it a priority to uphold consumer protections. Unsolicited calls and text messages violate these protections, which is why I support the Stopping Bad Robocalls Act. This legislation requires consumer consent to receive calls and text messages from automated dialing systems and requires those who are sending robocalls to maintain records of consent they have received from consumers. Consumers will also have the ability to withdraw consent from automated texts and calls. This legislation also requires phone carriers to provide a call authentication technology so consumers can trust their caller ID again. It is required that this technology should not impose an additional line item cost to a consumer's phone bill. There will be also a process to help rural carriers implement this call authentication technology. Consumers should be able to block harassing spam phone calls without being charged extra. These harmful phone calls are defrauding our seniors and preventing our hospitals from providing timely care. Robocalls are a serious, pervasive, and persistent problem that are causing serious issues, particularly for our hospitals, seniors, and rural populations. These unwanted and unwarranted calls are illegal, and it is our responsibility to ensure that consumers are protected from these fraudulent calls. Illegal robocalls put Americans at risk of scams and frauds. It is time that we stop this abuse and do something about robocalls. I ask my colleagues in the Senate to join us in putting a stop to this nuisance to prevent violation of the American consumer's right to privacy. Once again, I want to thank you, Mr. Chairman, and the Energy and Commerce Committee, and the full House Representatives for passing H.R. 3375, the Stopping Bad Robocalls Act, and thank you for having me here today, and I yield back.
Dr. Burgess?
Thank you, Mr. Hearn, for coming and reinforcing what is really work this committee, subcommittee and full committee have been doing this year. As you know, we passed the bill yesterday on the floor. During the markup in this committee, Ms. Dingell and I actually had an amendment accepted that addressed the hospital portion that you bring up. That is critically important. People need to know that when their hospital calls, it is their hospital and not someone spoofing their hospital's number, particularly if they're giving out personally sensitive information. So I guess the next thing to do is for us all to robocall Senators Lankford and Inhofe so that, that it passed so overwhelmingly here in the House yesterday that my hope is that, a big vote on the House will sometimes get the attention of the people over on the other side of the Capitol, but we can't let up the gas. We can't take our foot off the gas. We've got to keep going. This is what people want us to do, and it was important work that got done yesterday. May not have done everything that you outlined in your remarks, to the extent that there needs to be fine-tuning or to the extent that there needs to be modification as it goes through the rulemaking process at FCC, so be it. But we got to start somewhere, and this bill yesterday was a good start.
I thank the chairman for the member day, and this is an opportunity. We don't often compliment one another across the aisle. I'm a new freshman here, and I wanted to make sure that the Commerce Committee knew that we appreciated this on all sides of the aisle. I think America appreciates it, and just as my colleague mentioned, I think we need to maybe put all of our senators on robocalls, and we could irritate them enough that they pass it over there. Thank you so much.
Thank you so much. Thank you. So, Mr. Delgado, you would normally be next, but Mr. Kilmer has asked if he could go before you because he has to chair a hearing or a markup of some sort. Is that okay? All right. Mr. Kilmer, you're next.
Can I just thank Mr.
Oh, of course.
For being here? I love your idea about robocalls to the senators. So thank you. He's walking out. He doesn't know I'm saying it.
I don't think I want to robocall
Thank you for your
mine.
wonderful testimony.
I'll robocall you.
You could robocall the New Jersey guys. All right. Mr. Kilmer.
Thank you, Mr. Chair and Ranking Member and the members of the committee. And I want to thank my colleague from New York for letting me jump the queue. And thanks for holding this member day. I think it's really important for members who are not on the committee to be able to share some of the challenges our constituents face back home. I'm here to speak with you about something that keeps me up at night. Some of you may know I was born and raised in a timber town on the Olympic Peninsula. It's a beautiful region in Northwest Washington, and that I now have the honor of representing. And though many people think of the sprawling metropolis of Seattle when they think of the state of Washington, the area I represent is quite different, and a majority of the land is actually quite rural. And Mr. Chairman, I think a lot of folks on this committee know this, rural hospitals are really struggling. A recent study found that 97 rural hospitals have closed since 2010, and earlier this year, Navigant found that 21% of rural hospitals are at a high risk of imminent closure. That equates to 430 hospitals in 43 states that employ over 150,000 people, and most importantly, that care for millions of our friends and neighbors. Despite the growing problem facing rural hospitals, last year the Trump administration put forward a policy called site-neutral payments that reduces reimbursement under Medicare for hospitals with affiliated clinics or care facilities. Those affected clinics and care facilities bring quality health care closer to folks in rural areas. But this rule cuts reimbursement by 30% in 2019 and 60% going forward to those facilities. And at a time when we should be protecting rural hospitals, this policy does exactly the opposite. It punishes hospitals for bringing medical care closer to the patients. In my district, that means Olympic Medical Center, the hospital where I was born, could lose $47 million over the next 10 years. A reduction in reimbursement for Medicare beneficiaries would go from $118 to just $47. This rule is especially harmful because it impacts many hospitals serving health professional shortage areas as designated by the Health Resources and Services Administration, meaning cutting reimbursements actually exacerbates that shortage by dramatically reducing the funds available to retain and hire healthcare professionals and purchase new medical equipment. Earlier this year, I went over to visit Olympic Medical Center and talked to them about the impacts of this rule. They told me that this rule has played a factor in OMC postponing a $15 million planned construction project. It may cause elimination of some services while also forcing the hospital to change plans to hire 8 new primary care providers. My district's not the only one impacted. In fact, it's not even on the list of the top 30 hospitals across the country, including Southwestern Vermont Medical Center, Central Vermont Medical Center in Mr. Welch's district, Dartmouth-Hitchcock in New Hampshire in Ms. Custer's district, Cox Medical Center in Branson, Missouri, in Mr. Long's district, all in the top 30 impacted worse than Olympic Medical Center. Now, in 2018, as CMS was exploring this rule, 138 bipartisan members signed a letter urging CMS not to adopt this rule, but unfortunately CMS ignored this request. CMS argues that reducing these payments will increase competition with private providers. That argument is based entirely on flawed logic and faulty assumptions because it assumes that there are numerous private providers in every region and that people who go to hospital clinics would be able to get seen by someplace else. That misses the point that these hospitals tend to care for more medically complex cases and will care for every patient, even if they can't pay. Private providers have no such obligation, which means that as hospitals lose money and capacity, access to health care will be put in serious jeopardy, especially in those areas already suffering from a lack of health care. Not only is this rule bad policy, it also exceeds the authority of CMS. Section 603 of the Bipartisan Budget Act of 2015 affirmed that no existing off-campus hospital clinics should have their payment rates reduced. Additionally, in 2016, in the 21st Century Cures Act, Congress expanded those protections to cover clinics that were in the process of being built when that Bipartisan Budget Act of 2015 was passed. So, the arbitrary rule actually violates both of these laws. It is essential that this Congress acts to ensure that legislative intent is upheld in law and to prevent further damage. And out of concern for the damage this rule is doing to our hospitals, I've introduced bipartisan legislation called the Protecting Local Access to Care for Everyone Act, or the PLACE Act. The PLACE Act would freeze this, it's HR 2552. It would freeze the site-neutral rule until December 31st, 2020, directs CMS to reimburse hospitals at the previous Medicare reimbursements rates for the money lost under the rule since the policy went into effect. The American Hospital Association and the Federation of American Hospitals have both endorsed this bill, and I'm asking for your help because Olympic Medical Center is literally the only game in town in one of the most remote rural regions of my district. And if these hospitals and clinics close, the next option for care can be hours away, and that's just dangerous. This is a really critical issue for the folks I represent and for a massive part of the country, and I thank you for your attention, and I ask for your help.
Did you want to comment, Ms. Escher?
I did. Thank you, Mr. Chairman. Thank you, Derek, for coming here today and for your testimony. To the ranking member of the subcommittee and Mr. Pallone, I met with Mr. Kilmer at his request. We have to pay attention to this. This is, it's not just in his district. This is a rural hospital issue. I believe, am I recalling this correctly, that, that you had even gone so far as to identify how this would be paid for, or am I confusing that with something else?
We didn't stipulate that in the bill, but you know.
But this has bipartisan co-sponsorship. This really deserves the attention of our committee. So I want to work with you to resolve this. It's troubling to me that this was brought about by a reversal of policy in the administration. And but whatever it is, we have to contend with it. And I pledge to you that I'll work with you to resolve this, because people's lives are. You're holding all of these people in the palm of your hand, and we have a responsibility to them. So thank you for being here today. We'll work with you, and let's see what we can get going post August recess.
Thank you.
Okay.
Dr. Burgess?
I probably need to study the issue again, but in the Budget Act of 2015, the concept was that hospitals were acquiring medical practices and the reimbursement from CMS to the hospitals was 3 times what the individual doctors had been prior to the time their practice was acquired by the hospital. So it was really driving consolidation. We had a hearing on consolidation in the last Congress in the Oversight Investigation Subcommittee, and I will have to say I don't remember all of the moving parts there. But points you bring up are important. At the same time, I would just say to the committee, there are multiple moving parts here, and just like any time you move, this would be an argument for not expanding the federal footprint in healthcare delivery, but anytime you move one piece in that big puzzle, a lot of other things change. So it needs to be done with some care. I don't think it's fair to say it's all on this administration because it was passed back in 2015. And I know I heard from MD Anderson Hospital, not in my district, but just outside, because they were concerned that their cancer clinics would be affected because there were more than 200 yards from the front door of their hospital, which was, I think, if I recall correctly, that was the stipulation that was in the Budget Act. But point made, and we do need to take it seriously. There are reasons that was done back in 2015, probably reasons the rule was delayed, reasons that you allude to, And anytime you move one piece in this, a lot of other pieces move unintentionally, and we need to be careful with it. So thank you for bringing it to our attention.
Thank you.
Mr. Peters.
Thank you, Mr. Chairman. I would like to thank Mr. Kilmer for bringing this issue to our attention. It's a reminder, as you can see very clearly, even though I don't represent a rural area, that you can see very clearly how this rule is affecting access in his district. And it's a reminder again that one size doesn't fit all. What could be a very sensible approach in a urban district where there's many providers just may not fit at all in an urban area. So I think we should look at this. We should take a look at your bill. And I'll look forward to working with you on this, Mr. Kilmer, so we can get it right. Thank you.
Thank you, Mr. Chair.
Thank you, Derek. We've been saying over and over all the time here since 10 o'clock that we have to make sure that rural areas have access and affordability, and we can't neglect them because too often that's been the case. So we're certainly going to take another look at this rule. Thank you. And I wanted to thank Mr. Delgado for waiting. You're next, but we're going to switch the chairs here. I'm going to ask our chairwoman of the Health Subcommittee to replace me. Thank you, Anna. Mr. Delgado, you're recognized.
All right. Thank you, Chairman Pallone and Chairwoman as well, the subcommittee and Ranking Member Burgess. I appreciate the opportunity to come before the committee today to talk about an issue that is critically important for me and one I've prioritized from the beginning of my commitment to serve New York 19. And that is healthcare. It's just unacceptable that the United States, the richest country in the world, is also the only developed one without a universal healthcare system. This is one of the top reasons why I came to Congress, and I'm proud to be here today to share with you a bill I introduced to finally get us to that goal. H.R. 2000, the Medicare X Choice Act, establishes a public option plan available for purchase on the individual and small businesses exchange. I want to thank my colleagues, Representatives Higgins and Larsons, for working with me on this important legislation. The folks I talk to back home want more coverage options at lower costs. Importantly, the Medicare X Choice Act would deliver by allowing those who are happy with their employer-provided insurance to keep it, while giving another, more affordable coverage option to those who need it. My bill would combine Medicare physician networks and reimbursement rates with ACA coverage standards to create a new public option available to all Americans. The effect of creating a public floor in the private marketplace would be to drive down premiums and deductibles for everyone. Another critical aspect of this legislation addresses the urgent priority for New York 19 constituents and those all across the country, and that is the cost of prescription drugs. As we all know, currently Medicare is unable to negotiate drug prices with the pharmaceutical industry, a travesty. And my bill will change this by allowing for such negotiation through Medicare Part D, and these prices would carry over to Medicare X. Lastly, my bill would expand access to premium tax credits to those beyond the 400% of the federal poverty line, the current threshold for premium assistance under the ACA. With this bill, we're introducing more choice and more competition to the marketplace, starting in the places that need it most, like rural areas without provider shortages. Our constituents expect us to take on the big issues impacting their lives, not shy away from the hard decisions. Lowering the cost of healthcare should not be partisan. Taking on the skyrocketing cost of prescription drugs should not be a divisive issue. I'm here to be a part of the solution. I encourage my colleagues to co-sponsor the Medicare X Choice Act and join me in urging consideration of this bill to achieve universal coverage. I thank my colleagues again for the opportunity to talk about this issue that I care so deeply about, and yield back the balance of my time.
Thank you. We thank the gentleman for making time to be here today and congratulations on your legislation, and today is all about welcoming the ideas that members have. So, thank you. We will do that.
Thank you.
Your passion for the subject matter is more than self-evident.
Good.
Dr. Burgess?
May I just ask a question, Ms. Delgado?
Absolutely.
What is the
half hours north of New York City? It includes the Hudson Valley and the Catskills. It is the third most rural seat of any Democrat in Congress and the 8th in the entire country. It is made up of the best collection of small cities and big towns in the country. I believe the largest population center is Kingston in Ulster County, which is only about 25,000 people. So that is why it is one of the more rural seats, a land of plentiful dairy farms, fruit and vegetable farms, the Delaware River, one of the best trout fisheries in the country, along with the Hudson River and the beautiful Catskill Mountains. Come on by.
maybe we ought to do a field hearing?
It sounds like we need to travel to your district.
Hey,
Just,
it's God's country.
It is, yeah.
Well, you
The
heard-
whole country is God's country, yeah.
You heard Ms. DeLauro talk about her issue. As I mentioned, the Medicare for All was discussed in the Rules Committee, but I believe we need to have a major healthcare hearing in this committee, and I'm not the chairman, so I can't welcome you to come back, but I'll bet there would be a favorable disposition to hear your ideas and
Appreciate that.
perhaps to have that included in whatever the healthcare hearing looks like when we do get around to doing that in this committee. I feel certain we shall. I just don't know when. But thank you for bringing those ideas. Again, we probably disagree about a number of things, but nevertheless, it deserves to be heard. Thank you.
Much appreciated. Thank you.
Thank you, our colleague, Mr. Delgado. Now it's a pleasure to recognize and welcome Congressman Keller from the great state of Pennsylvania. Welcome.
Thank you, Chairwoman, and thank you, Ranking Member. I'd also like to thank the members of the committee for allowing me to testify about the importance of Pennsylvania's natural gas industry. Pennsylvania's natural gas has far-reaching economic and geopolitical benefits, both to the Commonwealth of Pennsylvania and the United States. The record is clear. Domestic natural gas production strengthens our communities and makes our country safer. Pennsylvania's natural gas industry supports more than 300,000 jobs, contributes $45 billion to the Commonwealth's economy, and saves the average household $1,100 per year in energy costs. This means more financial security for families, making day-to-day life more affordable. The success of natural gas in Pennsylvania and across the United States has completely shifted long-term thinking about American energy policy and our role in a global energy marketplace. Not long ago, the United States was energy dependent, relying on foreign adversaries to meet our energy goals. That's no longer the case, thanks in large part to our nation's robust supply of natural gas. Paired with a strong economy, American energy production has significant implications for our national security and our relationships abroad. For the first time in 6 decades, the United States is a net natural gas exporter. We can now use our energy exports as leverage in our foreign policy, giving our allies flexibility while diminishing the influence of unfriendly nations. Natural gas production is also environmentally sound. Natural gas is the cleanest and lowest carbon-emitting fossil fuel and has helped the United States to reduce carbon emissions by more than any other country. Pennsylvania has reduced carbon emissions by 30% in the last 10 years. Mostly because of increased use in natural gas-fired electric generation. We have a great opportunity to create some good-paying jobs, lower energy costs, and expand America's role as a global economic leader. To continue with this success, we must do more at the federal level. I am committed to supporting policies that allow the natural gas industry to grow and expand into new markets. Unfortunately, some states are abusing the state environmental permitting processes to stop critical pipeline infrastructure. Just last year, New England imported natural gas from Russia because infrastructure cannot pass through New York. It's absurd that an individual state can threaten our national security and interfere with interstate commerce. I look forward to working to stop these abuses, allow companies to transport gas to market, and strengthen our national security. Again, I would like to thank the chairman, the ranking member, and the members of this committee for allowing me to speak about the importance of natural gas for our nation's economy, the environment, and our national security. Thank you. I yield back.
Thank you, Mr. Keller, for your excellent testimony. What part of the overall energy portfolio of your state is represented by natural gas? Do you know?
The natural gas, we actually have our energy portfolio standards, and currently right now there's probably up to 20% that's renewables, up to that. That's by 2025. Actually, in Pennsylvania, I did do some legislation to help solar energy production in Pennsylvania, so that's one thing I worked at the state level. Natural gas is probably, I'm going to say 35% or between 35 and probably 45%, just off the top of my head, as I remember. Nuclear energy's big in Pennsylvania. We're one of the states that has larger states for nuclear production also.
Thank you very much. Dr. Burgess?
Thank you, and thanks for your testimony. When I first started on this committee in 2005, we had hearings about how America was running out of natural gas and the crisis that was developing because of that. So the fertilizer people were saying we don't have the feedstock to create the fertilizer that we need to have the farms to grow the corn that we need to provide the ethanol. And then it all changed with horizontal drilling, hydraulic fracturing, which you know well. And we've now become a net energy exporter, and there are geopolitical implications. Countries that used to be entirely dependent upon the former Soviet Union for their energy now have another source for that, and that can be the more friendly United States of America. So it really has been, just in the brief time that I've been on this committee, the world literally has changed, and it's changed because of the ability to produce and, as you point out, move natural gas from the point of its origin to the point where it's consumed. It's an important part of our energy infrastructure. It's an important part of our economy, and you're correct to be focused on it. And we need to maintain that focus as well. So thank you.
I appreciate that concern. You know, when you look at natural gas, it lowers energy costs for families. So families that lower income families, it helps them. It has also helped the Commonwealth of Pennsylvania. They had an $800 million surplus in the past budget cycle. So it has helped the Commonwealth of Pennsylvania, and I think it can help our nation just as well as it has helped the Commonwealth. Thank you.
I think Representative DeLauro spent that on her health care.
Excuse me?
I'm just kidding. I'm just kidding. I said I think she spent your surplus.
Okay, well, I think we can spend that ourselves in Pennsylvania pretty well. Thank you.
Thank you. It's a pleasure to welcome and recognize our colleague from Texas, the Honorable Vicente Gonzalez.
Thank you.
And who I just want my colleagues to know, a week ago, it was a week ago, it's almost
right.
2 weeks ago now, hosted a congressional delegation in his district in Texas, and we appreciate what you did for us.
Thank you.
It was more than an eye-opener, and your hospitality is so gracious and warm and welcoming. Thank you. So you're recognized.
It was a pleasure having you.
You have 5 minutes to present your
Thank you.
idea
And
to us.
I'm here on a different issue, but as a Texan and a chairman of the Oil and Gas Caucus for the Democratic Party, I agree with everything Congressman Keller had to say.
I saw you nodding.
It's shameful
I noticed
to
that
see,
you were nodding.
It's
Yeah.
shameful to see a Russian vessel plugged into a terminal in New England selling us Russian gas. So.
Oh my God.
But thank you, Chairwoman, and thank you, Ranking Member, for having us and allowing me to testify before you about the importance of including direct and indirect remuneration or DIR fee reform in your discussion on how to best lower prescription drug prices. These price concessions are imposed on community pharmacists serving Medicare Part D patients by plan sponsors and their pharmacy benefit managers, or PBMs. Rather than including these concessions at the point of sale, these retroactive fees are taken back from pharmacies months after the sale has taken place, exploiting patients, the government, and our community pharmacies. I can't think of any other business in the world that would be required to sell a product to a consumer without knowing what it costs it themselves. These unpredictable fees increase patient costs, sharing for drug, pushing them into coverage gap, better known as the donut hole, and accelerating their approach to the catastrophic phase increasing Medicare spending at the expense of taxpayers. These fees are costing taxpayers, patients, and small businesses money and are most importantly not contributing to improved patient outcome. I think we can all agree that without prices that make these life-saving drugs accessible, innovation for the sake of innovation is not why we were sent to Congress. I'm thankful for this committee's promises to lowering prescription drug prices. I think the American people are relying on you. I commend you all for your bipartisan consideration and the passage of H.R. 2296, the More Efficient Tools to Realize Information for Consumers Act, or the Metric Act, which requires for price concessions to include DIR fees to be reported to the Secretary of HHS, along with other pricing documentation. Given your consideration of H.R. 2296, I ask that the committee consider H.R. 1034, the Fair Pricing Act of 2019, introduced by myself and Congressman Doug Collins of Georgia. Mr. Collins and I have worked with Mr. Welch and Mr. Carter and Mr. Griffith to ensure that DIR fee reform is included in efforts to lower the cost of prescription drugs. The Fair Pricing Act seeks to reduce prescription drugs costs for seniors by bringing all negotiated price concessions at the point of sale. I can't think of anything that makes more sense. Ensuring savings are passed on to patients that our community pharmacists are not taken advantage of through DIR fees or indirect remuneration. The Fair Pricing Act also defines standard quality measures and sets criteria by which they are developed and applied to pharmacies. Addressing these fees would not only refocus an important part of our drug supply chain to improve patient health, but combat the financial uncertainty that these small businesses face, enabling them to continue serving Medicare beneficiaries. I look forward to working with this committee, the Center for Medicare and Medicaid Services, our Senate colleagues, and the President to address these fees that are hurting our seniors, our small businesses, and our taxpayers. We are seeing our community pharmacies across the country disappear. Again, I thank you for all your leadership in lowering the cost of prescription drugs and ensuring that these policies address the role of PBMs, that they're playing in increasing cost of medications that our seniors are taking or that the American people are taking. I thank you for taking this issue up in such an important fashion, and I thank you for your time. I yield back.
I thank the gentleman. We have taken up some legislation that tracks some of the elements of your legislation relative to manufacturers, PBMs, the discounts that are negotiated, and they say that those discounts move on to the providers, and that patients win because their premiums are lowered. I don't think the committee really went for that, that notion that was really the outcome. And so what you have as one of the, the basic values of your legislation, I think on a bipartisan basis, the committee agrees with. Yours is very directly goes to Part D, and that's where the money is.
Right.
And
our pharmacies
so I think that,
need to have certainty that whatever they're selling, they know what it costs them themselves, and right now we don't have that.
And we're very fortunate because the only pharmacist in the entire House of Representatives is the gentleman from Georgia, Mr. Carter. Did you want to say something? Yes, you're recognized.
Mr. Gonzalez, thank you, Representative. I appreciate this very much, and you're spot on. And I just want to thank you for bringing this to the committee's attention. And Madam Chair, I wanted to ask, Congressman Doug Collins, who is one of the primary sponsors of the FAIR Act, is unable to be here, but I wanted to ask for unanimous consent to submit his letter and to be included in the record. And also, earlier this year, the CMS had proposed a rule about DIR fees that unfortunately was not finalized. And we, along with with Representative Gonzalez, along with Peter Welch, another member of our committee, and Morgan Griffith, another member of our committee. And in fact, there were 20 members of the Energy and Commerce Committee, as well as over 100 other members of Congress who signed this letter to the President expressing our disappointment, and I wanted to add that as part of the record and ask for unanimous consent. Thank you, and thank you again, Representative.
Thank you, Congressman.
Dr. Burgess?
I'm smart enough to not get between Buddy Carter and DIR fees.
It's some slippery stuff, which is part of the problem, right?
So I just, and I agree with what Mr. Carter said, but I also wanted to point out I have been to your district a number of times over the years, lovely district, and the doctors at Renaissance Hospital is certainly one of the gems of the medical delivery model in this country. So
right, they are. Thank
HR 3062, which would allow for continuation and expansion of physician-owned hospitals, is a cause that I now carry with the retirement of Sam Johnson from our state.
Thank you. And I support you on that.
It is an important concept. They do a great job down there. I always enjoy it every time I get to visit their campus, and they do a lot of work on the border health.
Love to have you back. Let us know.
Again, I'm not a frequent flyer, but still, I've been to the McAllen Airport enough times that I know where the best restaurants are.
Yeah.
Well, there's only one, but anyway.
Thank you.
Thank you for your presentation today.
Pleasure.
And he hosted us at 1, so it was wonderful. I'm still full. Thank you. Thank you. We will work with you. Now, we have the pleasure of recognizing the Honorable Stacy Plaskett, the delegate from the Virgin Islands. You have 5 minutes, and this is the second time we're meeting today, the two of us.
Yes.
And I think that you're going to raise some of the issues that we spoke to, and look forward to your testimony. Welcome.
Thank you.
Welcome and thank you.
Thank you, Madam Chairwoman Eshoo, and Mr. Burgess, thank you as well, and for the committee for allowing many of the members the opportunity to present brief statements about our views on some of the areas that this committee deals with. I'd like to use this time in particular to speak about healthcare concerns on the island territories in the United States. You know that we all need significant investment in healthcare in this session. Even before the severe natural disasters of the last 2 years, the healthcare systems in the territories were under great distress. Specifically regarding Medicaid, the arbitrarily high local match required of territories under Medicaid imposed severe and unsustainable financial demands on the territories. Each of us have tried to resolve these very differently and have had little success in doing so up until now. Up to 30% of the population of my district could lose access to health care unless Congress takes action to eliminate the fiscal cliff that we know we are facing due to Medicaid. And Congress must act to prevent this potentially calamity before September 30th. I'm so grateful that this committee has really taken on that task and has taken action to address that cliff by moving legislation, H.R. 2328, the REACH Act, which includes the language of Mr. Soto's bill, the Territory Healthcare Improvement Act, to provide an additional stream of Medicaid funds for the Virgin Islands and other territories from fiscal year 2020 to fiscal 2025. Under this bill, for my district, the Virgin Islands, the Medicaid cap would be increased by an overall $756 million over 6 years. The rate of federal matching funds for Medicaid in the Virgin Islands would also be raised, temporarily at 100% for fiscal year 2020, 83% for fiscal years 2021 to 2024, and 76% in fiscal year 2025. Without this additional funding stream and at least another year of waiver for any local match required for Medicaid, the resulting Medicaid cuts would put healthcare delivery at risk not only for Medicaid recipients on our islands, but actually for the population at large. Due to the large amount of individuals on Medicaid, our hospitals and other systems are solely dependent on Medicaid revenue, which help us to understand how lost Medicaid revenues would hurt healthcare providers in private practice as well. And I have to say that I'm so appreciative of this legislation. I would respectfully request, however, that the Virgin Islands have the ability to carry over any unspent funding provided in any given fiscal year to a later fiscal year in order to improve the flexibility in the way dollars are able to flow and to better ensure that the beneficiaries will see the services they need in full for the full entirety of the bill's 6-year period. Lastly, I would also like to highlight healthcare needs of the territories that fall outside of the Medicaid funding cliff. Even before the 2017 hurricanes, the Virgin Islands 2 hospitals, publicly owned, have been excluded from the Medicaid Disproportional Share for Hospitals, or DISH program, in spite of disproportionate amount of care provided to low-income patients. The exclusion of all of the territories from Medicaid DISH and the small territories from Medicare DISH, Puerto Rico receives the Medicare DISH, has had a major health issues in the territories for many years, resulting in significant uncompensated care costs, burdens on providers, hospitals, local government across the islands. If you talk with the hospitals, this in many ways necessitated the reason why we had the type of destruction we did within our hospitals, where the hospital had to make the decision, are we going to pay our doctors or are we going to get a new roof put on our hospitals? We lost both of our public hospitals in the storm in 2017 and are waiting modulars now while we are primarily doing triage care and having people medevaced out for any long-term care in the Virgin Islands. We have 2 emergency rooms on each island that are operational, which is very, very a precarious situation to be in. I've sponsored legislation joined by my colleagues from the territories and others to correct inequities we face under all of the federal health programs by eliminating the Medicaid cap, providing for fair inclusion of the territories in Medicaid and Medicare, as well as other issues. It also tries to address Medicare Part D low-income subsidy programs and address exclusion from the healthcare insurance exchange program under the Affordable Care Act. I recognize that my time is over. That is under legislation in this session, H.R. 1354, the Territories Health Equity Act of 2019. We confront difficult reality living in the territories. U.S. citizens have been neglected and allowed to fall behind. I trust that this committee sees the importance of this and is willing to work with us to resolve these issues. Thank you.
Well, I thank you, Stacy, very much. I think on the first issue that you raised relative to rolling over of the funds, I already spoke to Mr. Pallone about that, and we look to be helpful to you, and I don't see any reason why funds can't be, unused funds from one fiscal year can't be rolled into another. The DISH issue, as I said to you today earlier, is a larger one, but we appreciate what you said about the work that we've done together. I think that there's a sense of pride here on the committee on both sides of the aisle, and you saw an expansion of the commitment to the territories. We'll keep working together, and before the legislation goes to the full House post-August recess. So thank you. Dr. Burgess, did you want to? No.
Thank you. We love that there's an August recess to be able to work on this. Thank
for many
you so
reasons.
much.
Right. Thank you, and have a good one, and thank you for being here today. I'm glad that I mentioned it to you, yes, and that you took us up on it. The chair requests unanimous consent to enter the following into the record. Joint testimony of Mr. Cummings of Maryland and Mr. Rupersberger of Maryland. Joint testimony of Mr. Kelly of Pennsylvania and Ms. Capter of Ohio on behalf of the House Congressional Auto Caucus. Testimony of Mr. Raskin of Maryland. Testimony of Mr. Engel of New York. Testimony of Mr. Gomez of California. Testimony of Ms. Moore of Wisconsin. Testimony of Mr. Payne, New Jersey. Testimony of Mr. Biggs of Arizona. Testimony of Mr. Swalwell of California. Testimony of Mr. Smith of New Jersey, and testimony of Mr. Cisneros of California. Without objection, so ordered. And is there anything that you have, Dr. Burgess?
We'll do it again real soon.
Okay. I want to thank the members, most especially Dr. Burgess here for the participation in today's hearing. Members Day, I think that we learned a lot, have much to appreciate in what they brought forward, and even more work to do at the committee to help meet the needs that they have in their congressional districts. So we're grateful to all, and at this time, the committee is adjourned.